Hello, sir. Hello, everybody. Hello, everyone.
Hello everyone, good afternoon. My name is Sakshi Sharma and a mental health representative in PDF Care. Good afternoon everyone. I'm Preeti Yadav, Senior Dietitian at PDF Care. PDF Care is an organization that focuses on holistic wellness by bringing together physiotherapy, nutrition, fitness, and diagnostics under one roof. Our aim is to provide personalized and prevent healthcare that support recovery, balance, and healthier livings. On the occasion of World Physiotherapist Day, we are now moving forward to begin our session. We are delighted to have our first speaker, Dr. Sandeep Negi, a senior physiotherapist at PGIMER, Chandigarh, with expertise in rehabilitation sciences. Now over to you, sir.
Thank you. Good afternoon, everybody. Myself, Dr. Sandeep Negi, senior physiotherapist at PGI Chandigarh. About myself, I'm currently involved in many projects and some of the articles I'm working on. First of all, I want to congratulate the organizing team of this event for their conscious and continuous effort. After that, I would like to welcome all the speakers as well as all the participants of this event. And one most important thing, I would like to say Happy World Physiotherapy Day in advance. It's on 8 September. Let's start program. I'm going to talk about AI in physiotherapy, revolutionization, rehabilitation, and patient care. This is a very vast topic. I'm going to cover the whole topic due to constraint of time. I will just summarize few things. First, definition of AI. Artificial intelligence or AI is the simulation of human intelligence processes by machines, especially computer systems. These processes include learning, acquiring information, and rules for using it. Reasoning, using rules to teach, approximate, or definite conclusions, and self-corrections. First of all, what is machines and what is the use of AI? Machines are the things which are used to make things easy for human beings and less our efforts. Hence, be machines or AI, the main target is to make life easy. Some of the examples of AI applications include voice assistants, example Siri, Alexa. Recommended systems include Netflix, YouTube, autonomous vehicles, self-driving cars, which are quite common these days. Also chatbots and customer service automation. What is most important in our field, in medical field, is medical diagnosis tools and language translations, which includes Google, etc. In simple terms, we can say the difference between natural and artificial differences. Artificial intelligence is natural intelligence is what humans and animals use to think and make decisions. But artificial intelligence is the machines trying to imitate that thinking using data and algorithms. Hence, in natural intelligence, we can use our emotions and we decide how to do things. But machines will just imitate the things. Artificial intelligence is transforming healthcare very big time, including physiotherapy, because physiotherapy is quite upcoming profession. It offers innovative solutions for diagnosis, personalized treatment, and remote rehabilitation. Applications of AI in physiotherapy include virtual physiotherapy assistance, motion tracking and gait analysis, predictive analytic for injury prevention, personalized exercise plans, remote monitoring, and tele-rehabilitations. First of all, virtual physiotherapy assistant. AI-based chatbots and virtual assistants help guide patients through exercises. They provide reminders for therapy sessions and offer real-time feedback. It may be possible in future times These AI-based equipments or these things, they may like work as alarm, or they may work like the mother to just help you get up and start your exercises and with regular reminders. As I told you, they provide reminders for therapy sessions and offer real-time feedbacks. They will tell you what is wrong about you, what you need to do things on the real-time basis. They help in reduce dependency on physical visits to the clinics. Next is motion tracking and gait analysis. Gait analysis or gait lab system is a modern concept which is quite in fashion in most of the high quality institutes, especially like in PGI, AIMS, etc. AI systems use computer vision to analyze posture and gait patterns, helps in identifying abnormalities and tracking patient progress. These are used in sports rehabilitation and orthopedic cases. This is the one of the applications of motion tracking and gait analysis, but this is not only used in sports rehabilitation or orthopedication. It can be used in all types of gait analysis, including in Parkinson's or any neurological disorders. Next is predictive analytic for injury prevention. It's one of the most upcoming event of AI, in which we can predict the injury pattern, and we can improve on that with precaution, and we can prevent any type of injury. AI models predict risk of injuries based on patient data and biomechanics. We can simply just check the pattern of walking when a patient or when a subject enters in your setup. We can just tell them that he is prone to some kind of these injuries or not, based on their just gait analysis. This helps in designing preventive rehabilitation programs. We can tell them to improve their gait, work on muscle strengthening or muscle tightness. These are commonly applied in athletes and post-surgical recovery. But again, predictive analysis and these things are not only for athletes and post-surgical recovery. These can be applied in every neurological conditions or every rehab setups. Integration of AI with the rehab wearable and devices. Wearables sensors collect real-time motion, heart rate, and muscle activity data. This is very must thing for every person, not only a sports person, every individual nowadays. In one of the studies I'm conducting in PGI, I have conducted almost 400 to 500 sports person, but none of them were using these wearable devices, which is an essential thing in European setup or other countries. Even a little kid, he used to carry these wearable devices to monitor their health. But in India, I think 4 or 500 subjects I checked, but none of them were using any type of wearable devices. That can be improved in our setup. AI analyzes this data to provide feedback and modify treatment plans. Based on this integration, improves accuracy and ensures personalized care. Now I'm going to talk about my this work on this spine concept. Currently, I'm doing in PGI Chandigarh. I'm working on a spine concept. Its name is Dept spine concept. It is an equipment for complete spine care. It includes starting from assessment to training to treatment. All the three concepts are included in this. These are some of the machines. If it is visible to you all, this is like we will first this setup is for lumbar and thoracic extension. Next is thoracic rotation. Next is lumbar and thoracic flexion. Then for cervical, these things, cervical extension flexion, lumbar thoracic lateral flexion, and cervical rotation. These are helping activating the whole spine column in all movement planes, not a single plane, but all movement planes. All devices measure range of motion and based upon that force. And this is the CPU, we can say, as each professional, which all the data is stored, and we can like it's a complete measurement and monitoring system. It completes evaluation, monitoring, and motivation to increase quality of training. All the devices are networked and communicate in real time with each other. is again about the professional. It's a complete measure and monitoring system, evaluation monitoring. Already I spoke about. All devices are networked and communicate in real time. This provides the biofeedback and guidance while performing on the machines. Again, about this determinants, these are all the some of the parameters which can be checked, and we can get the graphical representation and as well as numerical data on this. This guides patients through the exercises with each biofeedback, visual as well as audible biofeedback. Visual feedback on actual movements improves the motor control and motivates patients in improving their results. This gives immediate feedback after training on quality and quality. Measurement and program editing functions. These are user-friendly touch screens, graphical user interface with RFID login. We provide a magnetic chip, which is an individualized login ID for every individual. This is a wireless transmitting to all training and measurement data to the main program. These spine concepts have functional evaluation objective. Measurement adding to the clinical status. Before treatment, the functional status is evaluated with tests in all movement planes of the spine, which includes mobility, strength, and strength relation. The tests are performed on the EVE measurement system of the spine concept devices. These values are compared to a database of reference values that is dependent on the patient's age, gender, weight, and height. Based on this, we can calculate BMI, body weight, head weight, and lower body weight. The treatment program measurement results. We can also collaborate all the questionnaires and are used. We can, based on these individual assessment, individualize the treatment programs. Loading and movement ranges based on these measurements help to design a better protocols. The goal of treatment program is to increase the motor control, metabolism, mobility, and strength of spine in a safe and controlled movement because it is based in lab setup, eventually to restore the structural integrity of the spine. In balanced strength of the antagonist movements are also taken into account in a program because these all the movements are taken into controlled manner. Hence, antagonists are also taken care of. The weight and range of motion limits are automatically calculated from the patient's measurement results. The individual treatment parameters and patient's fixation mechanisms of the devices guarantee safe training. These are the outcome analysis and objective evaluation of the achieved results is undertaken after the treatment program, which helps in clinical assessment by the measurement of mobility, strength, and strength relation. We can further add subjective questionnaires to help the clinical assessment. The outcome spine profile provides invaluable information in demonstrating the restored function of the patient. In most cases, the outcome report and questionnaires results are sent to the referring doctor for evaluation or physiotherapist for that matter. Home exercise and stretching instructions are given to help prevent further problems. In most cases, patients request an ongoing prevention program, the designs of which is based upon the outcome report. Prevention training is undertaken independently with the physiotherapist following the program through the EVE system. The software we already discussed 2 times. This was all about this thing. I am working in PGIMER. Now, the role of AI in tele-rehabilitation. AI enables remote monitoring and virtual, especially like in the times of COVID. This thing can be of great help. It reduces travel time and increases accessibility to patients in rural areas. This leads to real-time correction and progress tracking through smart devices. Now coming to the benefits of artificial intelligence in physiotherapy. First is it improves the accuracy in diagnosis. Diagnosis is, however, the tool of every physiotherapist, but it can vary physiotherapist to physiotherapist. But with the use of artificial intelligence, we can improve the accuracy of diagnosis. We can personalize our treatment plans. We already discussed. This can continuous remote the patient monitoring at different remote areas where it's not possible to reach physically. AI in physiotherapy is cost effective and time saving. We can simultaneously work on many patients together. It enhances the patient engagement by use of both visual or uh, audible biofeedback. This most important thing, next point which I want to add is quantification of assessment and treatment parameters. Benefits of AI. The most important thing we lack in physiotherapy is the availability of many quantified tools for our assessment and treatment parameters. With the use of AI, we can easily quantify our assessment and treatment parameters, which can next lead to replication and hence evidence-based practices. The more quantification is there, the more replication will be possible. Hence, this will add to the evidence-based practices. Now coming to challenges and limitations. The first important thing we all know is a high initial cost of implementation is there for AI because it needs quite both patient plus physiotherapist or any that medical professional education. Then only it can be implemented. So it's a higher cost of is there. One another thing, this data privacy and security concerns are there. This is quite a challenging thing. We are not we can never be sure that there will be no leakage of any data. Hence, there will be security concerns. With modern equipments or modern these things AI, this seems to be quite lessened, but still there are concerns there. One more thing, we need to have skilled professionals. If we don't have any skilled professionals, we can't expect to any layman to do these AI things. Just typing messages on chat GPT or WhatsApp is easy, but to exactly implement the AI in any form, we need to have skilled professionals. Last and most important, limited awareness about among patients. Like in our setup in PGI, most of the patients, I believe 40 to 50% patients are either less educated or not educated at all. Just to give them AI based rehab, AI is quite challenging. Hence, it has limited awareness among the patients. Future of AI in physiotherapy. Integration of AI with all wearable devices, which I believe there should be, like every person should be wearing that wearable devices to track their performances, their health status. That can be done. Next is more accurate predictive models can be made based on the AI for our rehab in all things like assessment, treatment, and like protocols. Advanced robotics for rehabilitation already is all working, like especially in neurosetters for stroke and any other conditions. Widespread use of virtual reality in therapy can be possible with the use of AI in physiotherapy. Conclusion, AI in physiotherapy is revolutionizing patient care by making treatments more personalized, efficient, and accessible. Despite challenges, its future looks promising with continuous advancement. Thank you. I'm just trying to just summarizing the things. I'm not actually, due to time constraint, I will not able to focus on details. Thank you so much for your patient hearing. Thank you so much.
Thank you so much for this insightful talk, sir. We are some questions related to it. एक फिजियोथेरेपिस्ट के लिए एआई कितना का लिमिटेड या कितना ही यूज कर सकते हैं अगर हमें एक इंडिविजुअल का पर्सनलाइज्ड प्रोग्राम बनाना हो रिहैब सेंटर से रिलेटेड?
किसी भी सेटअप में सबसे इम्पोर्टेंट पार्ट होता है कि उसकी यूजेज के लिए AI यूजेज के लिए आपको सबसे पहली चीज मैंने क्या बताया, नॉलेज इंपॉर्टेंट है। स्किल बेस्ड प्रोफेशनल्स होने चाहिए, तभी हम उस चीज को यूज कर पाएंगे। ठीक है, अगर फिजियोथेरेपी प्रोफेशनल है, हमें एआई को ज्यादा से ज्यादा यूज करना है अपने फ्यूचर उसके प्रोडक्टिव उसके लिए, तो वो सारे प्रोफेशनल्स होने जरूरी है, तभी हम उस चीज को कर पाएंगे। अगर बेस्ड ऑन हमारे एआई इन स्टार्टिंग, जैसे मैंने बताया था कि सबसे इंपॉर्टेंट पार्ट होता है कि मशीन्स और एआई लर्निंग इज टू मेक लाइफ इजी, और हमारे को वर्क एफिशिएंसी बढ़ानी है। तो एआई और मशीन्स दे आर जस्ट यूज टू इम्प्रूव द एफिशिएंसी। ठीक है, बट अगेन वन मोर कंसेप्ट, और पीपल मतलब जिसके बारे में लोगों को डर लगता है कि ये ह्यूमंस को रिप्लेस करेगा। कोई रिप्लेस नहीं होने वाला। ह्यूमन ब्रेन इज लाइक, मेरे ख्याल से 5% भी एक्सप्लोर नहीं हुआ है अभी, तो बहुत कुछ एक्सप्लोर करना। अगर 5% एक्सप्लोर ना होने के बावजूद भी हम अगर एआई को यूज कर सकते हैं, तो देर इज लॉट्स ऑफ स्कोप, तो वो रिप्लेस कभी नहीं होने वाला है। अगर एआई एडवांस होगा तो ह्यूमन ब्रेन भी एडवांस होता रहेगा।
Yes, sir, definitely. Sir, one more question is कि current limitation क्या हो सकती है AI की in real time motion analysis?
इसमें अगेन हमारा डिपेंड करता है कि जैसे सेटअप्स में जितने भी होता है, रियल टाइम हमारे को वो चीजें डाटा हमें मिल पा रहा है कि नहीं है मिल पा रहा है। अगर हमारे को मतलब इट्स ऑल डिपेंड्स अपन, एआई के लिए सबसे इंपॉर्टेंट चीज है क्या चाहिए आपका, कह लो नेटवर्क, कह लो डिजिटल नॉलेज होना चाहिए, तभी हमारे पास चीजें उस टाइम फ्रेम में अवेलेबल होंगी। वही हमारा लैक करेगा इन प्रेजेंट सेटअप इन इंडिया, या हमारे सेटअप में वो चीज अवेलेबिलिटी नहीं होगी, तो हम उस चीज का मतलब रियल टाइम में सॉल्यूशन निकाल भी नहीं पाएंगे। वी नीड टू इम्प्रूव ऑन दैट सेटअप ओनली, एंड इन फ्यूचर वी कैन से कि अगर ये चीज हुई तो डेफिनेटली मतलब हमारे लिए मे बी 100% पॉसिबल हो।
Okay, thank you so much, sir.
थैंक यू वंस अगेन एंड ऑल द बेस्ट। थैंक यू।
Thank you so much, sir. We are pleased to welcome Dr. Sunil Kumar, currently a research scientist and Origin Life Associate Professor at Riyadh Bharat University, Mohali, Punjab. He is engaged in cutting-edge scientific research and teaching with contribution in healthcare innovation and allied health sciences education. He holds a PhD from PGIMER Chandigarh and was awarded as a prestigious Central Postdoctoral Fellowship ICMR 28th Batch 2019, along with the Sud Ratna Award and the Best PhD Thesis Award. Now it's over to you, sir. Hello, sir, are you there?
Sakshi, it's okay. We can move on, and you can just coordinate. So no
Yes,
issues. I will.
good afternoon to all. My voice is audible.
Yes.
Yes,
Yes,
sir,
ma'am.
yes, sir, you are
I
audible.
hope I am visible. Am I visible?
Yes,
Actually,
sir.
I'm at home today.
Yes,
So
yes, sir. You are visible also.
thank you very much on behalf of my department, Rayat Bahra University. I would like to say thanks to the organizers and PGI Chandigarh and PDF Care. So that you have given me a chance to share my experience with all the students all over the globe. So today I'm going to share my slides. So just give me 1 second so that I can.
Okay, sir.
Share my slide because I already shared with the yesterday. So because I'm not able to like, because if I'm
Yes,
clicking
sir.
on
I will
this,
share. I will share. I hope दिख पा रही हूँ.
thank you very much for sharing my slides. Can you make in a presented mode? Yeah, thank you very much. My voice is audible?
Yes, sir. You are audible.
Yes, sir, you are audible.
Okay, so
We
thank
can
you
listen
very
you.
much. So here I am starting my presentation. So a little introduction about myself. I'm also alumni of PGI. I did my PhD from here, from Department of Parasitology, Medical Parasitology Research Block A. And so today we will talk about the AI. As Dr. Negi also already told about that AI is very now these days, because without AI, because everybody is using AI, whether it's a lab, whether we are preparing the reports or we are preparing other things related to diagnosis. If I am talking about the diagnosis, because AI is in labs, it is helping, it is giving you fast results also. It is helping in the preparing the results as well. Suppose if we are uploading some slides, or maybe microscopic slides, or maybe we are giving histopathology slides to the AI, and what I'm telling you, that AI is giving accurate and very fast results and very fast diagnosis, right? So it is also preparing, but in the at the end, it is also saying that please consult a physician, consult a doctor for the betterment management of your particular problem and disease, whatever it is. So, we have to be careful while we are using the AI, because if we will be dependent upon AI for everything, right? We are asking everything from AI, then there will be a problem like, coming futures. So the today's topic here is that how this particular AI in diagnostic lab and its impact on the health setup. Yes, it is giving, like, it is sometime it is also innovations, the biomedical research and technologies for better patient care. So it is it is a requirement, or you can say the requirement of current hours or current status, right? Because we need to treat the patient, we need to treat the people who are in pain on time, because on time diagnosis is very important. If we are delaying it like 3 days, 4 days, or more than that, because earlier the reports are coming in 4 or 5 days, because whosoever is working there in the lab. So these are the some challenges earlier. Now we overcome by these challenges in our lab also. Now, the main objective of this particular presentation to explain you about to understand the current challenges in diagnostic pathology, because I'm working here in a lab, Origin Life at Chandigarh Sector 38. We have a complete setup of this particular histopathology. So we are doing some of the work we are doing with the help of the manual methods, and after that, whenever we require any just to give the reports and results, we are also asking the decision of AI, and we are doing it. And we have 2 or 3 scientists. We are also checking it out. It's whether it's a report is correct or not. So in many countries, I'm not talking about only in India, but in many countries, people are using it. So if you are using the AI for diagnosis and treatment and other things, right, then you must be taking care of other options as well. Like, doctors, physicians, consultation is required. So in pathology, basically, it is in applied pathology, workflow is there. So moreover, it identify the key benefits, and AI enhance the diagnostic, that is sure. And we'll also discuss the real world examples and emerging trends, that how we can improve our diagnosis, how we can improve the lab services. So it recognize the challenges, and ethical consideration is also there, because ethics are, because if we are working in India, in Indian scenario, like, this ethical is very much important, right? So if I'm on the slide number 5, if you can please make it possible so that the audience can see the slide number 5. So these are the objectives. Now coming to the next slide, that is the introduction to the pathology. So as if we are going, most of the slide I prepare with the help of AI. I also go through with the other literature as well. So according to the definition, pathology is the branch of medical sciences that involves the study and diagnosis of disease through the examination of organ, tissues, bodily fluids, and whole body autopsies, we can say autopsies and biopsies as well, right? So it bridges the clinical and laboratory medicine, and also playing a crucial role in the patient care and disease prevention. So these are the things, if we prevent, earlier we are saying the prevention is better than cure. So now we can say that, the fast diagnosis of anything, whether it's a cancer, whether it's any kind of bacterial infection or any kind of any problem, right? So if we are diagnosing it on time, then it will definitely help the populations. And what is the basically the significance in the healthcare of this particular AI? Because it is helping in the diagnosis, it is helping in the treatment planning, and treatment planning like guides physician in the selecting appropriate therapies, and prognosis as well, assist the physician through like predicting the disease outcomes, that what will be the disease outcome there. So in research, it is also contributing to the medical discoveries and advancements, right? So in public health, it is the, if we'll talk about the public health, it supports the disease surveillance and control strategies that can be done in a strategic manner, right? So it is written on the slide number 7. And now coming to slide number 8, that is the current bottlenecks in the traditional diagnosis. So it is a time consuming process, as we all know, the current bottlenecks of in a traditional diagnosis, right? It is the manually, we are processing the sample, handling, and result interpretation delay the diagnosis. So limited sensitivity and specificity, it is also there that traditional method may not be detect early stage or the low abundance of disease. There will be some human errors also, like misinterpretation can be there, oversight can be affect the diagnostic accuracy, but with the help of AI, that can be sorted out, right? So lack of integrations and fragmented system leads to the like disjointed patient data and inefficient workflow that can be solved with the help of AI. So accessibility, we are talking about the accessibility that can also be increased. So faster diagnosis is the very, very important these days, because healthcare efficiency, faster diagnosis reduces the hospital stays and optimize the resource that will be used in the treatment of the patients, right? So why artificial intelligence in pathology? Because it is handling the large scale data, and it is also overcoming the limitations of the manual analysis, enhancing the reproducibility and the precision. So the key applications of AI in the pathology, I'm on the slide number 11. So if we see, it is the histopathological images analysis can be done with the help of AI. Cancer detection and grading can be done. Biomarker identification can be done, and prognostic modeling can also be done accurate and easy and fast. So this is the workflow. If you're going on the slide number 18, can you please go on the slide number 12? So where I want to show that this particular slide number 12, yeah, AI in the pathology. In the pathology, you can see in this particular slide the workflow chart from sample diagnosis reports, from sample collection to report. Digitization is there, AI processing is there, diagnosis is there, and report preparation is there. So see the step by step, all the steps together. Digitization is there, AI processing is there, diagnosis is there, and report is there. So digital pathology plus AI, I'm telling you, it is doing tremendous results and fast and accurate, and there is no chances of any kind of, you can say, false positive results or false negative also, because these things are very important. If we are playing with the life of the humans, right? Because the digital pathology plus AI is emerging in many countries like UAE or other, the Arab countries. They're already using these kind of facilities, because here in India, the challenges are funds. The challenges are, many challenges are here in India. Ethical challenges are also there, but cost effective. It's not cost effective. Cost is also there. But suppose if we are paying, lot of taxes are there, lot of things are there. So if we can just like compel the our hospital administrations, or if we'll show them that it is very important these days, so that can be purchased or that can be done, because the nobody is bigger than the humanity is the main you can say, humans are mostly important. The lives are mostly important. So if you go on the slide number 13, so there you can see the all setup of the lab of like pathology, like digital pathology, how it is working. The whole slide is given to the AI, and AI is analyzing with the quality control, and all things can be done, right? The preservation condition, the scan quality in the detection, the pre-analytic stage, analytic stage, and post-analytic stage. If you see, integrated diagnosis can be prepared, clinical information will be there, order necessary pathology styles, right? So automated pipetting can also be done. I'll show you one slide. One video is there in the end of this particular presentation. So you can see with the help of AI, the fastest, you know, you can see the difference, like cloud AI server management. They are preparing the multidisciplinary board, assessing the biomarkers, on demand consultation is there, pathology reports are there. So these things are, in practice now these days. Not in India, we are not doing it because they are very costly, but I'm telling you, the future is coming. We are just happy to see chat GPT and some of the one or two, three, and we are preparing PPT and we are doing other things. No, the AI is more than that. If you are using some of IIT students from Mumbai, from Delhi, they are giving the coaching, so they are giving these kind of webinars. They are doing these kind of like trainings that how you can use AI for the betterment of the society. So I think the student must join these kind of particular courses with the IITs graduates, so that they can learn how we can work with the help of AI. So if you go on the slide number 14, the benefits of AI, the next slide, please. So benefit of AI in the diagnosis pathology is faster diagnostic, improved accuracy, as I already explained in the slide, support of clinical decision making, and reduction in the human error and fatigue, which is I already told you that, there are like there is 0% chances like that there will be 0% chances that there is no chance of misdiagnosis, right? And false positive results. So how AI is revolutionizing, in the next slide you can see automated image analysis, deep learning of the cancer detections, integration with the digital pathology. So these are the tremendous tools which are helping the humankind. So AI can differentiate between malignant and benign cells and aiding in the early detection of the cancer diagnosis. If you see this, these are the need for AI in the pathology lab. Not only in the pathology, the AI can be used in the sample collection, in biochemistry, in microbiology now. You see, earlier we are taking 2 or 3 days to give the reports in microbiology. Now, with the help of AI, with the help of advanced technology, we are giving the results overnight. We are giving the results even after some hours. Okay, so need of the pathology is on the slide number. If you see the slide number 17 or 18, increasing the workflow on the pathologist. Right? So this is the way how we can help the, yes, how we can help the physician, how we can help the patients, how we can help the societies. So need of for ours is to use AI for the betterment of the results and increasing the workflow on the pathologist. Administrative burden can be reduced, growing number of cases or shortage of the staff can be solved, expectation to deliver a faster results that can be solved, possibly a call or the automation or support system like AI tools in the pathology can be incorporated. And it is already incorporated in many countries, right? And if you see on the slide number 18, demand of faster and the more accurate diagnosis is there. So mounting expectations from the healthcare system, pressure of speed without compromising the accuracy, potential burnout of workforce in the strain, right? So the need of the technological support is such as digital pathology or AI-based diagnosis is required. If you go on the slide number 19, then you can see how AI works in the pathology. There are one flow chart you can see. The machine learning and deep learning in the image analysis, how the image analysis is working. You can see observation with the help of microscope, then interference of module analysis, it is segmenting and it's tracking and it is classification. Analysis can be done on the basis of the interface module, and after that retraining of the module and with the help of annotations, and we can help the doctor, we can help the pathologist, right? So this is the power of the AI. You can see machine learning and deep learning in the image analysis. So I think this slides and this particular presentation will help you out that how you can understand the power of AI now these days in healthcare. We go the slide number 20, AI workflow, how AI works in the pathology. So see, in the biological sample of the tissue is coming, and the collection and fixation can be done manually, and dehydration and clearing. And after that, paraffin embedding. And this is how all these steps in the AI. All AI works in the pathology. So in pathology, AI is very important, you can say, and it is also increasing day by day, and there is no error of any kind of human error, and there will be no false positive results. You will get the accurate and perfect result with the help of AI. Suppose if you're, because I am saying why I am emphasis on it's very important and it's very easy and it's accurate and fast. Moreover, I just want to tell you that, whenever the first time the AI, the ChatGPT came, I was telling to the student and most of the teacher and professor, they are, saying that don't tell this thing to the students. Otherwise, they are going to make their notes. They are going to make, they're going to study. They will not use other things. They will not use books. They will not use other things. Now, see, the technology, in the starting, every technology is having some issues, some problems. And if we'll depend upon totally and depend upon AI, then our critical thinking and our other system, our brain will not start working, right? Our brain will not do those kind of like exercises, right? So, but along with the decision of the physician is also, we have to consider. And with the help of AI, we can increase the results. We can increase the, capacity in every day. Suppose if one person can see 1 or 2 slides or 8 slides or 10 slides, But with the help of AI, we can see hundred of slides in a day, or in a 3-4 hours, we can see multiple of patients. So these kind of things can be, very beneficial in the future. You can say in the healthcare system. So if you go on the slide number 21, how in that particular slide you can see that how AI works in the pathology, right? So this is the particular global, you can say color normalizations and how the image is coming from the sources and how they are analyzing, like color transfer using deep networks and color normalization after the stain separation. So normalized image is looking like that, normalized image. So these kind of things you can see, they can see in multiple images. Earlier the other things also came into play, but now AI is coming, then we have to accept it and we have to incorporate these AI tools in our daily life, in healthcare system and in other system, education, studies, and everywhere it is used, right? So now coming to the slide number 22, the data-driven decision making, like data collection, how it is working exactly. Can you please go on the slide number 22? Data-driven decision making, data collections, data processing, cleaning, data analysis, AI, ML models are there, insight generations, decision making, action implementations, and monitoring and evaluations. So before starting my lectures, in every lecture I am saying that if you have to make the goal of your particular, whatever the area in which field you are working, so make that you want to be in the circle of concern or circle of influence, right? If you are influenced by someone, if you're influenced by someone, or if you are influenced by any person or motivation or motivator, right, then you are going to do that particular work for the betterment and for the betterment of your knowledge, for the betterment of the society. Because if we are using that particular system or particular tools for the betterment, for good work and for the society, then it is okay. And if we are using it for other things, other work, then it can be destructive. And it is also said by great scientist Dr. Abdul Kalam Azad also, because science knowledge, if science we are using for the constructive manner, if science and knowledge we are using for the constructive and betterment of the society, then it can give you the tremendous result, and it can give a better like place and better healthcare systems also. But if you are using it in a destructive manner, if you're asking the question which is not related, or which is not making any sense, because whatever you are asking to the AI, the AI will give you the answer for that. The AI will give you, and AI will give you, mentor you in a better way, right? So now coming to slide number 23, how AI works in the pathology. It is already, I have shown you in the previous slides and in the flow data. So I just don't want, I'll just give you some, crisp and brief slides so that you can understand how it is working in the pathology. So AI applications on slide number 24, that AI application in the pathology, that image recognition and classification, right? How image recognition and classification is there, like, identifying the patterns in the histopathology slides, automated detection of the abnormalities, and AI model can highlight the cancerous and precancerous regions with high accuracy. So with the help of these results, the pattern recognition is beyond the human perception. So you can see the power of deep learning. It identifies the stable morphological features that may be missed by the human eyes. So see the power. So consistent and scalable analysis can be done, reduced variability in the diagnosis, and it enables the high throughput screening of large slides, which is I already explained in my previous slides, that large slide volumes can be done in hours or in minutes or in seconds as well. So decision support of pathologies, right? So on 25th number slide, you can see the AI application in the pathology. This is the flow, how it is working. So see pathologist in the center, you can see that how the pathologist is relaxed, or my pathologist, you see that how accurately the classification and uncertainty can be measured, right? So this is the power, this is the way how AI is working in the pathology. So if you go on the slide number 26, you can see the AI application in the pathology. Predictive analysis can be done, AI driven prognosis and treatment suggestions. So, this is the power. You can say the treatment suggestions can be given. AI model analyze a large database and personalized treatment plans. Early risk stratification can be done, and continuous learning and the adaptations can be done with the help of AI system. It improves over the time by learning from real world and outcomes, and clinician feedback can also be, improved. AI application in the pathology. On 27 number slide, see the AI application in the pathology. So it is doing automation of the routine task. How it is, improved. Slide scanning can be done, data entry can be done, right? And quantification of tasks can be done very easily, right? So error reduction and the workflow efficiency can be increased. Now coming to the slide number 28, the benefits of AI in the pathology. You can see here the enhanced diagnostic accuracy in these following steps, like advanced imaging technology, AI and machine learning for pattern recognition, genetic and modeling testing for the precise diagnosis, point care of diagnostic for immediate results, big data and predictive analysis can be done, right? So clinical decision support system, CDSS, or evidence-based recommendation, as earlier explained by the Dr. Negi, that evidence-based recommendations are there, very, very, very important. Now evidence-based studies are coming, evidence-based medicines is coming, improved training and the multidisciplinary collaboration for the better diagnostic skills. Now all people under the one roof, under one umbrella, they can all work. Microbiologist, pharmacologist, physiotherapist, and orthopedician, and everybody, medicines, cardiologist, my and I'm telling you, neurologist, everybody, if they are ready with these particular tools and they are going to use, I'm telling you, they can do tremendous in the healthcare systems, right? So benefits I had already explained you. Now coming to the slides number 30, that benefits automation AI, that is already done. Error reduction algorithm can be solved. So other benefit, if we can see the slide number 31, the benefits of AI in the pathology, genomic testing, biomarker discovery, AI in machine learning. Now pharmacogenomic studies are there, also determination. If you see, pharmacogenomic studies can be done, right? The patient's genetic makeup can be done with the help of, I'm telling you, 3 days back, there was one mishappening happened in my family. My son fell down from bed and he has fractures. So what I did, I took an X-ray of his arm and I uploaded in the with the help of Chat GPT, because I'm using it from when it was came into the picture. So I uploaded the picture and of that particular, and I asked that tool that, okay, please let me know if any fracture is there of any. Can you please help me with this particular X-ray image, that can you see? And I'm telling you, I have done for 3 or 4 patients, because people in my near area, they're asking me, sometime, my owners, they're asking me, so can you see this particular report? Can you see this particular X-ray report or something like that? I'm just uploading and I'm seeing that, okay, is there any? Then I was shocked that, whatever the preparation of, particular, recommendation given by AI, I really shocked that it was accurate and it was, there was no error in that particular report. So that is the power of AI. I'm just telling you, if you are uploading the things there, then it will be helpful. Early diagnosis and treatment can be benefited. So patient can be benefited from out of this. So electronic health records can be maintained, personal treatment history, wearable devices like monitor and adjustment of treatment in real time can be done, and patient care specific models can be like stimulating the treatment outcomes before implementation. So this, which is very important. So now coming to the case studies, real world examples, I want to show you the slide number 32, where you can see these are the some systems for breast cancer detection. People are already using in other countries. AI in UAE, Dubai. I got these some of slides from one of my senior, Dr. Ranjay, Dr. Ranjay Chaudhary. He worked in like UAE, Dubai from last 25 years. He came back to India and I got a chance to work with him. He also presented these slides like in conferences as well. So some of the slides I got from him, and he suggested me you can present these slides there so that you can aware the people, aware the student about these benefits. So in UAE and Dubai, they are using it already because he already with the most of the countries, and he settled all these particular AI systems, labs, pathology, microbiology, hematology even. So this is the power of AI. So adoption of like tertiary care hospitals, AI assisted cancer detection is also there. So breast, lung, prostate cancer, because these things are there in the market as well and in the tertiary care hospitals. So if you go on the slide number 33, you can say how AI works in the cytopathology lab. I already told you in how it is working in the different area, but if you see in cytopathology, it is also working. So slide number 33, you can see the AI applications, image acquisition, it is working there, FNAC and scanned using the high resolution, right? And it is also helping in the processing of noise reduction, normalize, segmentation of cells, isolating the nuclei, feature extraction can be done, classification, model, and CNN and decision trees, like these kind of, benign, atypical, malignant, these kind of, problems can be solved or can be sorted out with the help of the classification and with the help of AI. Speed up diagnosis is there. So assisted diagnosis can be done. AI flags the suspicious areas of the pathogenesis to review the speeding up screening. So now coming to the slide number 34, I have left only just five to like only just I am 45 slides prepared for this. So I think I am on the right time. So how all works in the hematology. So hematology involves the study of the blood and its disorder. So you can say automated blood smear can be analyzed, cell counting can be done, morphological studies can be done, detection of hematological malignancies can be like leukemia, lymphoma, that can be detected and can be spot morphological abnormalities suggestive of leukemia, right? So integration with the flow cytometry data can also be done. Predictive modeling can be done. So AI uses lab data, patient history to predict the disease progression on or the response to the therapy. That can be done with the help of AI, and it is very, very fast. And AI-driven workflow optimization in the pathology lab. So these are the steps: sample collection, labeling, digital slide preparation, image processing of the standardization of these particular optimization of the pathology lab. Now I am going to show you some a very small clip is there. If you go on the slide number 38, that is the benefits of AI workflow in the integration. Like what is the benefit? If we go for the automations, right? Automation reduces the manual labor and the errors and faster turnaround, faster and turnaround. Okay, so this is the benefit. Shorten the diagnosis time, standardizes the interpretations, efficiency can also be increased, increase the lab throughput screening and analytics. What it can do enables the performance and monitoring. So it is on the slide number 38. If you go to slide number next slide, 39, you can see challenges and limitations. So these are the challenges and limitations, like that data bias sometimes, algorithm transparency can be a problem, data privacy concern, limited standardization and regulations, pathologist skepticism or the resistance can be there, right? Some people say, okay, now we need to go to the pathologist and we have to go for the second opinion like that. Okay. So need of regulatory approvals we require. Yes, these are the challenges in the AI acceptance, integration with the existing medical workflow, ethical consideration, all there. And the funds, the issue is also the funds also are there. Some challenges are there. So the future of the AI in the pathology, integration with the electronic health. If you go on the 41 slide number, integration with the electronic health records, explainable AI in the diagnostic, AI-assisted precision pathology, collaborative decision-making tools, and advances in the deep learning and the neural networks can also be solved. So see, in the future of the AI pathology, AI-powered and power telepathology will be started sooner. AI assisted pathology education and training can be given. Now role of AI in the precision medicine. So now coming to the conclusion, the slide number 43, that AI as a supportive tool, not a replacement of pathologists. So I'm just emphasizing on that. People are saying the pathologist job is going, teacher job is going, professor job is going. No, it's not like that. AI as a supportive tool, and it is not a replacement of any one of us, right? It's not a, because it also requires the people, the who can the use. So continuous evolution AI technology is important. Collaboration between AI expert and the medical professionals. Recap of AI and transformative potentials, emphasizing on the human AI synergy and path forward innovation, education, and ethics. This is the main, message from my side and from my mentors, that innovate, education, and ethics. If we follow all these things in along with AI, then nobody can, put a finger on you that you're using AI and AI is not helpful. AI is helpful, and we need to accept it, and we need to consider some ethics also. So this is one video I want to show you. Some video which was given by one of my senior from UAE. He also set this particular lab there. So kindly be with us. So let's, I think. So this was the last slides from my side, and if anybody have any questions, if I'll be able to answer it, or if I don't know, then I will definitely give the answer of your questions and queries. If you have any questions, please do ask. Or thank you very much. So I can expect one or two questions from the audience or from the organizers. If you have any questions, please do ask. Thank you very much. I hope I was audible to anyone, everyone.
So it was really a very insightful session. Thank you so much.
Thank you, sir, for that wonderful talk. We have some interesting questions coming from the audience.
Yeah, please, sure.
First question is,
Yes.
कौन सा ऐसा डाटा प्राइवेसी कंसर्न है जो हमें ध्यान रखना चाहिए पेशेंट सैंपल हैंडल करते टाइम, पेशेंट सैंपल रिपोर्ट्स हैंडल करते टाइम?
यस, इसमें ये है कि जैसे पेशेंट्स का जो प्राइवेसी है, जैसे सपोज HIV के कुछ पेशेंट्स होते हैं, बिकॉज स्टिग्मा होता है, तो HIV के कुछ लोग हैं ना, उसको नहीं डिस्क्लोज करते हैं कि पेशेंट्स को HIV है या नहीं है, राइट? एक तो ये हो गया। दूसरा प्रेगनेंसी रिलेटेड, राइट? प्रेगनेंसी रिलेटेड PCPNDT के कुछ ऐसे एक्ट हैं, तो ऐसी चीजें हमें नहीं किसी के साथ शेयर करनी चाहिए, बिकॉज देखो, PCPNDT के एक्ट जब किसी चीज का आ जाता है, जैसे कि डायग्नोसिस करने में मेल है या फीमेल है, राइट? या फिर कुछ ऐसी, क्योंकि फ्लूइड बेसिस भी ऐसी बहुत सारी चीजें हैं कि हम फ्लूइड से भी पता लगा सकते हैं। आजकल ऐसी ऐसी किट्स अवेलेबल हो गई हैं कि जिनसे पता लग सकता है कि होने वाला जो बेबी है मेल है या फीमेल्स है, राइट? और पैथोलॉजी में जो पैथोलॉजिस्ट है उनको पता लग जाता है, बिकॉज दे आर वेरी इंटेलिजेंट पीपल्स, राइट। देखो एआई भी ह्यूमंस नहीं बनाया है, मेरा तो कहने का मतलब है कि ह्यूमन ब्रेन से पावरफुल ऐसी कोई भी चीज नहीं है आज की डेट में जो कि ज्यादा हो पावरफुल, इन द सेंस वी हैव द कैपेसिटी, लाइक जो सोचने की क्षमता है, जो मतलब उसको विवेक, जिसको पंजाबी में बोलते हैं विवेक दान, जो जो हमें भगवान ने दिया है, वो चीज ह्यूमंस के अंदर ही है। देखो मशीन तो क्या, मशीन में एरर भी आ सकता है। एरर कहाँ से आ सकता है? अगर मशीन प्रॉपर तरीके से ना काम कर रही हो, नहीं वर्क हो रहा हो, या डेटा करप्ट हो जाए, ऐसी चीज है, तो एरर्स के चांसेस हर जगह होते हैं, राइट। सो डेटा ये है कि हमें किसी भी पेशेंट्स का कोई सभी किसी भी तरह का डेटा नहीं शेयर करना चाहिए, चाहे डेटा कैसा है, यू विदाउट द कंसेंट, विदाउट द प्रायर परमिशन फ्रॉम द पेशेंट्स। I hope
Now, the
you got
second,
my answer.
yes, sir. Now the second question is AI showing histogram and some information are awesome, but can sometimes can go wrong anyhow.
Yes, can sometime it can chances बहुत कम है, because it is through the networking, and it is through, like now internet also, because they are implementing जो भी डेटा हम ले रहे हैं। जैसे देखो एक डेटाबेस है, डेटाबेस से ही सारी चीजें आएंगी। अब आप देखो एक एआई टूल है जिसमें कि आप वो एक सिर्फ लैंग्वेज बेस्ड है, कोई एआई पर्टिकुलर टूल है, राइट। अगर एआई बेस्ड कोई लैंग्वेज बेस्ड पर्टिकुलर टूल है, तो आप उससे लैंग्वेज बेस्ड ही कुछ चीज पूछेंगे, या अगर वो इमेज प्रोसेसिंग वाला है तो आप उससे इमेज के लिए ही कहोगे, राइट। अगर ऐसे ऐसे टूल्स हैं, क्योंकि देखो अभी काम चल रहा है, बहुत सारे टूल्स ऐसे बन गए हैं, राइट। तो अगर वो चीज उस डेटाबेस में अवेलेबल होगी, उसका आंसर उस डेटाबेस में अवेलेबल होगा, तो ऑब्वियसली वो सही आंसर आएगा उसका, और सही चीज आपको जो है मिलेगी। अगर आप एक गलत एड्रेस पे गलत चीज पे देखिए, अगर आप पूछेंगे तो वहां से उसका आंसर नहीं आएगा, राइट। जैसे कि प्रोटीन डेटाबेस है, अगर देखिए, अगर हम रिसर्च के पॉइंट ऑफ व्यू से बात करूं मैं, एनसीबीआई है, लाइक एनसीबीआई वाला डेटा है, अगर हम एनसीबीआई वाले डेटा में कुछ ऐसा क्वेश्चन पूछ लें, कुछ ऐसा जो कि आउट ऑफ द बॉक्स हो, या आउट ऑफ उस वे में ना हो, साइंटिफिकली क्वेश्चन पूछने के लिए आपको एक साइंटिफिक डेटाबेस के पास ही जाना पड़ेगा। अगर आप गूगल में कोई भी क्वेश्चन पूछ लेते हैं साइंस से रिलेटेड, इट्स बेटर कि आप रिसर्च स्कॉलर उसमें देखें, गूगल स्कॉलर पे जाएं, वहां से पूछें, तो आपको एक साइंटिफिक चीजों का वो आंसर मिलेगा, राइट। बिकॉज गूगल इज अ डेटाबेस, राइट। गूगल क्या है? एक डेटाबेस है, उसमें वो आपको डिफरेंट डिफरेंट लिंक दे देगा, या वहां पे वो चीजें यूज होंगी तो वो आपको बता देगा, राइट। तो यही चीज है कि आप राइट टाइम पे एक एक्यूरेट सिस्टम या एआई सिस्टम या टूल यूज करेंगे, तो आपको जो है गलत इंफॉर्मेशन या गलत रिजल्ट्स आने के चांसेस जो है कम होंगे, राइट। मतलब हर एक चीज के लिए एक पर्टिकुलर सिस्टम, पर्टिकुलर टूल बना हुआ है। एआई सिस्टम में भी ऐसा हो गया है, पीपल आर वर्किंग, बायोमेडिकल इंजीनियरिंग के जो स्टूडेंट्स हैं, द स्टूडेंट्स हु आर डूइंग बीटेक बायोटेक जो कर रहे हैं आजकल, बहुत ज्यादा एडवांस में हो गया है, तो दे आर इंटीग्रेटिंग, दैट्स व्हाई द पीपल आर वर्किंग इन इंटरडिसिप्लिनरी और मल्टी डिसिप्लिनरी फील्ड जो है तभी आ रही है। अब देखो टेलीमेडिसिन पहले नहीं था, अब टेलीमेडिसिन आया, फिर उसके बाद अभी बात कर रहे हैं हम, एविडेंस बेस्ड मेडिसिन आ गया, वो भी आ गया, राइट। उसके बाद ये अब ये है कि पेशेंट्स को जरूरी नहीं है कि आप पेशेंट्स जिस चीज से ठीक हो रहा है आप उस चीज को वो चीज दें। पेशेंट जरूरी नहीं है कि एलोपैथी से ही ठीक हो रहा है, या फिर आयुर्वेदिक से ठीक हो रहा है, या होम्योपैथी से ठीक हो रहा है। नो, आफ्टर कोविड वी सी मेनी मेनी थिंग्स आर देयर इन द मेडिकल साइंसेस। सो इंटीग्रेशंस हो रही है मल्टीपल फील्ड्स की, अलग अलग फील्ड्स की, हाउ वी कैन सर्व द ह्यूमैनिटी, हाउ वी कैन सर्व द सोसाइटी, दैट व्हाट रिसर्च इज, आई थिंक। जो चीजें हैं अगर हम उसको इस वे में लें कि वी नीड टू सेव द ह्यूमैनिटी, वी नीड टू सेव द पीपल, राइट। सो चाहे साइंस वो कैसी भी हो, वी नीड टू सेव दिस थिंग, राइट। तो हमें जैसे इन्वायरमेंट को भी सेव करना है, ह्यूमंस को भी बताना है, और बहुत सारी चीजें फैक्टर जो है मैटर करते हैं एक करेक्ट डिसीजन के, एक करेक्ट रिजल्ट आने के, राइट। चाहे आप एआई से ले लो, चाहे आप मैनुअल मेथड से ले लो, बस मल्टीपल फैक्टर्स आर responsible for this. I hope my answer is very near about, so you can correlate this answer. Yes.
Yes, sir. Thank you so much, sir.
Any other
Now,
question?
No, sir. Thank you so much. Now we are welcome our third guest, Miss Shubhi Dubey, founder of Human Screening AI and the leading voice in AI readiness in education. With her background as a journalist and researcher at Johns Hopkins University, she is now spearhead the AI readiness skills mission, empowering millions of students and educators to embrace the future of AI, and is currently working on her dream project, India's Got Intelligent Stories, which showcase the best AI use cases and AI technologies with an objective to make everyone AI ready. Over to you, ma'am.
Thank you so much, Sakshi, for such a wonderful introduction. And first of all, let me share my screen and then we'll start the session. Okay. Is it visible? I think you guys can see it.
Yes, ma'am.
Okay,
Yes,
fine.
ma'am.
फर्स्ट ऑफ ऑल आई वुड लाइक कि सबसे पहले सब लोग अटेंडेंस लगाएंगे. आई थिंक आई कैन सी ऑलमोस्ट 40 पार्टिसिपेंट्स who are in this live session. So just a quick engagement. How many of you are just ensure you are present here. आज का जो ये सेशन होने वाला है, हम आई विल बी ट्राइंग माई बेस्ट कि मैं आप लोगों के साथ में इंग्लिश में बात करूं, जिससे आप लोग सभी का जो एंगेजमेंट है वो बना रहे. एंड इस सेशन को एक होलिस्टिक माइंडसेट से देखना. एंड आई रियली वांट, आई कैन सी द चैट्स. आई थिंक मलिक इज वेरी वेरी एक्टिव राइट नाउ. देयर इज वन राशि चतुर्वेदी, शी इज आल्सो वेरी एक्टिव. देयर इज मेड वाइब हब. So I can see all of you, you guys are active here, and I really want this session to be engaging. And when I'm saying this session is on AI readiness, तो अब AI readiness की अगर बात करेंगे तो उसे आप स्लीपी मोड में देख भी नहीं सकते. So now over to my presentation. बीच में किसी को भी कोई भी डाउट हो, दे कैन आस्क मी. मैं पहले से ही आई एम रेडी विथ माई चैट्स. आई रियली वांट एंगेजमेंट इन दिस सेशन. सो स्टार्टिंग, आज का सेशन का नाम है AI readiness. एंड first I would like to congratulate PGIMER Chandigarh. Also I want to congratulate PDF Care. बहुत अच्छे से आप लोग ने ऑर्गेनाइज किया है ये वेबिनार. एंड ऑल्सो दिस इज द नीड ऑफ द आवर. ये इस टाइम की नीड है. एंड व्हेन आई एम सेइंग आई एम अ ड्रीमर, बहुत जल्दी पता चलेगा विद दिस सेशन, बिकॉज आई एम ऑन अ मिशन टू मेक इंडिया AI ready. So yes, now I can see there are 38 participants. Okay, all right. So आज का सेशन है AI readiness for healthcare professionals. और आप लोग इंडिया को AI ready के साथ में healthy भी बनाने का काम कर रहे हैं. And that work is on me to make everyone AI ready. So when I'm saying this particular AI readiness, just one second, I have to see my slides are moving. Okay, I think it's there is no issue in that. Okay. About
Oh, sorry to interrupt, ma'am, but we are not able to hear you.
just one second. I think my audio is on.
अब आ रही है, ma'am.
Is it, am I audible now?
Yes, ma'am.
Okay, I think might be some latency issue. Okay. और मेरा बैकग्राउंड जर्नलिज्म का रहा है. So I was ex senior
Hello, ma'am. Hello. Hello, ma'am. We are not able to hear you.
second. Am I audible now?
Yes, ma'am.
Okay. Can you guys hear me?
Yes, ma'am.
Okay, fine. So before starting our session, this is one thing I want to share. My startup is Humans Winning, and with my partner startup imature.in, we are India's only team working full time on the concept of AI readiness, and we are doing this since 2023. And when I'm saying AI readiness, I think whatever I'm thankful to Professor Dr. Sunil sir introductions about how AI is changing the healthcare profession. Also, Dr. Negi sir, they gave me such kind of insight. But I can assure when I am saying about AI readiness, it is for everyone, irrespective of the background. So आज इस सेशन में हेल्थ केयर से जो लोग जुड़े हुए हैं और जो अपार्ट फ्रॉम हेल्थ केयर सेक्टर से भी हैं, इस सेशन को बहुत अच्छे से देखें, बिकॉज दिस इज गोइंग टू बी अ रोड मैप हाउ यू कैन अडेप्ट योरसेल्फ इन द एरा ऑफ एआई. आज का जो सेशन होगा वो मेनली 3 पार्ट्स में डिवाइडेड होगा. पार्ट 1 विल बी एआई एज डॉक्टर्स असिस्टेंट. पार्ट 2 में हम कवर करेंगे द फ्यूचर ऑफ हेल्थ केयर विथ एआई, व्हाट फ्यूचर इज गोइंग टू मेक अस सी विथ एआई. And part 3 will be AI readiness of healthcare professionals. And I think part 3 probably it is the crux of all this session what we are doing here. But why I'm saying part 1 and part 2 is also that much important, because it is going to create a context, and then you will be able to understand the part 3 itself. Okay, so AI has started assisting doctors, surgeon, healthcare professionals. As we all know, बहुत
Excuse me, ma'am. Excuse me, ma'am. We are not able to hear you. अभी नहीं आ रहा.
just 1 second. Am I audible now?
Yes, ma'am.
I think there is some problem with the network. I don't know. Just 1 second. Can you listen me now?
Yes, ma'am.
Okay. So, जितने भी यहाँ पर लाइव चैट से जुड़े हुए हैं, whoever is attending this session, I want you guys to write some examples how AI is helping. Malik said not audible, not audible. Am I audible now? Yes, ma'am, clearly. Just wait. Not clear. Okay, fine. So what are some examples? अभी हमने कुछ examples सुने थे. I will be bit slow so that you guys can listen to me perfectly. कौन से ऐसे एग्जांपल्स आप बता सकते हो? रोबोटिक सर्जरी, राशि चतुर्वेदी, वेरी गुड वेरी गुड. एनीवन एल्स? यस यस, थिंक रोबोटिक सर्जरी है. और क्या है? रोबोट असिस्टेड सर्जरी है. ग्रेट. इट इज आई थिंक ऐश is answering this. Great. Then Met Vibe Hub is saying gate assessment. Very good. Shivani is saying AI in public health. We will come to it. Definitely, this is a very important part, AI in public health. So these are the example. आप लोग राशि चतुर्थ again AI in pathology. Okay. These are actually the real examples which I can say medical diagnosis is also saying yes. Now, when I am saying AI has started assisting doctors, there is one MedVibe posture assessment. Yes, तो ये सारे जो roles हैं वो हैं assisting doctor, not replacing it. Okay. So when I am saying AI assisting doctors, some of the examples I also quoted here, and they are. Just 1 second. I think my slide is a bit confusing. Okay. World Economic.
Excuse me, ma'am. Ma'am, you are not audible.
Just 1 second. I can see now. Am I audible?
Yes, ma'am.
Okay. My network is fine here. I don't know what's the glitch, but it's okay. So AI can spot more bone fractures than human can. This is another use case where AI is assisting doctors. Then another, AI assessing ambulance needs, right? Another one, and these all I took from World Economic Forum in order to ensure the credibility, how and where AI is help assisting doctors. Detecting early signs of more than 1000 diseases. I have to check, am I audible? Is it clear? Rashi is saying not audible. Why I'm not audible? My audio is on. Is it clear now, Sakshi?
Yes, ma'am.
Okay, fine.
Yes,
So
audible, ma'am.
okay, fine. So when I'm saying detecting early signs of more than 1000 diseases, this is
Excuse me, ma'am. I'm not audible.
just wait. I will again not audible.
Ma'am, about you.
This is just one. Just wait. I will just share my presentation in a different mode so that the problem should not happen like this. Is it audible again? Just 1 second, but my
Yes,
slides are
ma'am.
changing. Okay, so we were in this session. And so AI for healthcare admin. I will be a bit slow so that everyone can hear me. Almost 42 participants joined. And now AI for healthcare admin. This is something which I wanted to focus on this point. I hope यहाँ पे जितने भी healthcare professional हैं, वो admin task is the most tedious and boring task, and nobody studies medicine to do admin task, right? So when I am saying admin task, AI is helping a lot in healthcare when it comes to admin. Now, this is important point to focus. When we know AI is assisting doctor, it is proven that sooner or later, AI will become the best assistant for doctors surpassing all humans. How many of you agree? 41 participants are there in the live chat. I really want to know the answers from you all. Will AI become the best assistant for doctors surpassing all humans? Do you agree or you don't agree? Quick. Okay. Whether you agree or not agree. Yeah, Sarah is saying agree. Rashi is saying yes, agree. Mohammed Irshad is saying agree. I think everyone agrees with my point. Yes, agree with you, ma'am. Okay, there is Pihu Vasisht. हम साथ में बैठेंगे इसका discussion करने. Pihu, we will have discussion together. Dr. Jean is saying yes. AI will become the best assistant for doctors surpassing all humans. This is proven. This is my analysis, my prediction that yes, it will become the best assistant. But why? The question is why? I think many of you must be thinking कि कैसे बन सकता है and what's the reason? I will give you the reason. AI will become the best assistant for doctors surpassing all humans because it is better, cheaper, faster, and safer.
Oh, excuse me, ma'am. Ma'am, आपकी voice.
Am I Sakshi?
Yes, ma'am. Yes, ma'am.
Okay, fine. So when I am saying it is better, cheaper, faster, and safer, now tell me, Everyone, is it a good news or bad news? Is it a good news or bad news? Tell me, quick, quick. Oh, Mariam is also saying not.
You are not. Excuse me, ma'am. We are not able to hear you.
Then I have to. Just 1 second. Why you guys are not able to hear me? I can't understand. My audio is fine here. Even my network is fine here. Is there problem at your end? Please check it once.
नो मैम, ऐसा हो रहा है कि ना जैसे आप बोल रहे हो ना कुछ टाइम बाद फिर वो अपने आप चली जा रही है। जब मैं आपको बता रही हूँ कि वो चली गई है, उसके कुछ टाइम बाद जब आप बात करते हो वो फिर आ जाती है। आई डोंट नो व्हाट द इशू।
Uh-oh. So it's not good then if this problem is happening. Just 1 second. Should I join again? I think it will work.
या मैम, या
Yeah, let me join. Let me join in a minute. Okay.
ओके।
Yeah. Just 1 second. I'm so sorry. Everyone is now. My voice is coming. Is it okay? Everything
यस
is
मैम, यस
fine.
मैम।
I'm so sorry. I can see 41 are still present here. I will again share my slides and then we will be good to go. Just pause for a while. Okay. I think am I better from before? Is it better?
यस
Yeah,
मैम,
Sakshi, for that I will need your help.
यस
तो
मैम,
let
यस
me know if I'm audible or not because अगर आवाज ही नहीं आएगी तो फिर how participants will be able to listen to me. Okay. Okay. I think my slides are also visible. तो कहाँ थे हम? Okay. So many are participating well. I can see good news, bad. Antara is saying bad for healthcare patients. Dr. Jean is saying good news in perception of advancement in patients' health. Okay, so many comments are there, but due to my problem with the voice, I will again start. Okay, so when I said good news or bad news, many are saying it's good news, some are saying bad news. I will say it depends on threats and opportunity sides, which side you are in. When we are saying AI is assisting doctors and AI will be surpassing all humans, important is to understand whether you as a healthcare professional or any professional is standing in which side of AI. Is it a threat side or is it an opportunity side? So then, opportunity side, doctors using AI assistants effectively will be doing diagnosis at much higher quality with much better quality treatment in much cheaper price at much faster speed, much safer processes for many more patients. So the crux is, if AI is assisting doctors, it depends. It can be a threat. हमें इस बात को समझने की जरूरत है. It can be a threat, but only when, if you are not using AI effectively. Anyone, especially the health professional, if you are not using AI effectively, those healthcare professionals will be wiped out by competition. And in a nutshell, what we say, अभी सुनील सर का जो सेशन हुआ है उसमें भी सर ने कहा AI can't replace human, but I think this line you might have heard. Jensen Huang, he is CEO of NVIDIA. NVIDIA is one of the biggest company जो GPUs provide कराती है artificial intelligence.
Excuse me, ma'am. Ma'am, you are not audible.
Am I audible now?
Yes, ma'am.
Audible now?
Yes, ma'am.
Sakshi, audible now?
Yes, ma'am. Yes.
Okay, fine. Great. I think I will just switch over to. Okay. So now I want to question you all. I think यहाँ पे बहुत सारे ऐसे aware citizens are also there. There are participants. Are you observing these trends? I am observing as an AI readiness evangelist. I am observing these trends, especially in the healthcare sector. हेल्थ केयर अवेयरनेस इन सोसाइटी आप देख रहे होंगे बहुत सारे प्लेटफॉर्म्स में, इवन इन स्कूल्स, कॉलेजेस, यूट्यूब चैनल्स, इसीलिए मैंने लिखा है फ्यूल्ड बाय इंटरनेट. हेल्थ केयर की जो अवेयरनेस सोसाइटी में आ रही है, इट इज समथिंग डिफरेंट. Currently, we were talking about AI as a doctor's assistant, but this is something which are new trends which we need to focus on. हाइपर पर्सनलाइज्ड हेल्थ मैनेजमेंट वियरेबल डिवाइसेस. आप लोग देख रहे होंगे कितने सारे ऐसे डिवाइसेस आ गए हैं जो हाइपर पर्सनलाइज्ड हैं एंड एनीवन कैन वियर देम एंड दे it is hyper personalized. It's monitoring every single thing, whether it's your blood pressure, whether it's your heartbeats, every single thing. Another reason, another trend, increasing affordability of such gadgets and AI. पहले हमारे इसके 3-4 साल पहले अगर हम देखें तो एप्पल वॉचेस जो आती थी वो बहुत ज्यादा कॉस्टली आती थी. नॉट एवरीवन कैन यूज इट, बट नाउ द अफोर्डेबिलिटी इज ऑल्सो इंक्रीजिंग एंड rapid progress in R&D in biotechnology fueled by AI. Please let me know in between. I'm audible, right? I'm perfectly audible now, right?
Yes, ma'am. Yes, ma'am.
Okay, fine. So yes, so when I am saying rapid progress in R&D and biotechnology fueled by AI, मुझे नहीं पता आप लोगों ने कितनों ने AlphaFold का नाम सुना होगा. Yes ma'am, I am audible. Okay, so AlphaFold, what is AlphaFold? किसी ने नाम सुना है AlphaFold का? Anyone can type here. AlphaFold is an artificial intelligence program which is developed by DeepMind. ये किसने बनाया है? गूगल ने. 3D स्ट्रक्चर ऑफ प्रोटीन ये आइडेंटिफाई करता है एंड रिसेंटली इन्हें नोबेल प्राइज भी मिला था. इट प्रेडिक्टेड ओवर लैक ऑफ 3D स्ट्रक्चर ऑफ प्रोटीन. कुछ डेकेड्स में डॉक्टर्स की रिसर्च में हम कुछ ही प्रोटीन्स के स्ट्रक्चर्स फाइंड कर पाए थे, बट विद द हेल्प ऑफ AI वी discovered so many. Can you understand? Are you guys feeling the power of AI? Lacks of structures they found. These are the trends which are somehow hinting towards a shift. And वो shift क्या है? The market of curative healthcare. That means the number of patients in hospitals and clinics may grow much slower, stop growing, and even shrink because of AI. You also can observe these trends, how it's happening. But the number of patients in hospitals and clinics, they will be growing slower, they will be stop growing, and they can even shrink. Do you agree or disagree? By all the trends, I'm not saying it will vanish. What? Curative healthcare. But a new vertical of healthcare is coming. So now, as I said, you guys can also say, are you agreeing or disagreeing that the number of patients in hospitals and clinics might be growing slower, they can be stop growing, and they can even shrink because of AI. So, which leads me to next part of my session, then what will be the future of healthcare? It's proven now, and I firmly believe this, that AI will become the best assistant for doctors. They will come, and in curative healthcare, they are going to be biggest change makers. बहुत ज़्यादा changes आने वाले हैं. But when I am saying another shift is coming in the healthcare field only. So what's that? Now we will understand the future of healthcare with AI. Anyone know him? 36 participants are there. I can see all of you. I think someone is suggesting use wired headphones if possible. I was using wired headphones, but the congestion was coming. Am I audible right now? Because it was creating a lot of problem, and that's why I just removed it. Audible. Yeah. Okay. Thank you, sir. Thank you so much. So anyone know him? Okay. So because there is some problem with audio as well. Okay. He is Brian Johnson. अगर आप लोगों ने रिसेंटली निखिल कामत, जो कि जीरोधा के फाउंडर हैं, को फाउंडर हैं, उनके साथ में पॉडकास्ट हुआ था, ब्रायन जॉनसन, ही इज ब्रायन जॉनसन, एंड ही इज वर्किंग ऑन अ project blueprint. Okay, and this project blueprint is related to longevity and anti-aging. So he has this whole setup जहां पे वो सिर्फ इस बात की रिसर्च कर रहे हैं कि आप अपनी हेल्दी लाइफ स्पैन को कितना ज्यादा आगे बढ़ा सकते हैं. In short, in a nutshell, I will say, you live beyond 100 years without any diseases, without any problems. Healthy aging, healthy living. और इनका बहुत in world itself longevity पे बहुत focus किया जा रहा है. So many companies are already investing in this project. So this is Project Blueprint, which says future of healthcare is now shifting its direction to preventive healthcare and longevity. That means this shift is from treating the sick patients to keeping healthy individuals healthy. Okay, so when I am saying the market shift is happening, this is the time where you understand where opportunity lies for you, and where the best opportunities as a healthcare professional you can align, from treating the sick to keeping healthy individuals healthy. Again repeating the threats and the opportunities. Well, opportunities are definitely in the sites where AI assistants in curative healthcare will be assisting doctors. Why? It is much better, it is much cheaper, it is much faster and much safer. And then AI fueling preventive healthcare and longevity. And any healthcare professional, if they are aligning themselves with the opportunity side, they will be having advantage of this era. Unfortunately, in threat part, I have to say there is no career ahead. if not becoming AI ready. Because we all know the power of AI. Sometimes I feel so, it gives me goosebumps just by watching the power of AI, how advanced it's getting. और जब free version और unpaid version की powers इतनी ज़्यादा है, so you can guess what's the power of AI when it's paid, when it's trained very well. So focus on this. Anyone who is listening to this webinar, understand there are threats coming in, and for that you have to become AI ready. But when I am saying grab the opportunities and save yourself from threats, it's important to understand, after all, what AI readiness is and how to become AI ready. Because in order to become AI ready, you must develop some skills. अभी बहुत foggy है, everything is foggy. You sometimes people are like, should we use AI or not? Are we killing our critical thinking? And how we have to use AI? And are skills getting obsolete? There are so many doubts. In this further part of our session, we are going to clear it. What is AI readiness? AI readiness is first accepting, understanding, and adapting to both sides of AI, that is threats and opportunities. What we did in this session, in part 1, we saw the news, we saw the clips, how AI is going to be the best assistant. And I am happy many participants here agreed with this point that yes, AI will become. So you are already one step ahead from others to become AI ready. You accepted the fact AI is coming, AI is here for us, AI is not stopping. Second, most important, understanding. It is not possible just by accepting it and then getting away with it. It is enough. Now you have to understand where the trend is leading. If I am saying acceptance and understanding, then only the next level of AI readiness comes, and that is adapting to both sides of AI. And in order to adapt, you have to develop some major skills which will give you insight how to become AI ready. It's time for myth busting. See, ये myth busting बहुत important slide है. And whenever I am in some sessions, whenever I'm talking about AI readiness, people directly connect it to technology. So I really want to ask all the participants, is machine learning part of AI readiness skills? You can just type yes and no. Is IoT, Python, are these a part of AI readiness skills? AI, ML, data science, also mastering AI tools. Quick. Are these part of AI readiness skills? Okay. Bharat is saying yes, it is part of AI readiness skills. Okay. Antra, is this okay? Sandeep Singh Seni is saying yes, it is part of AI readiness skills. Okay, so you think IoT and machine learning, Python is part of AI readiness skills. Rashi Chaturvedi is also saying yes. Great, great. I am happy that I put this slide here so that I can make you understand why I wrote myth here. Yes. Anyone else? I will take one more engagement here. AI tools make you AI ready. Just learning, mastering AI tools. Now here we will understand the difference. It's very important to understand the difference between AI skills and AI readiness skills. Whatever I shared in my previous slide, data science, machine learning, robotics, IoT, Python, they are AI's technical skills. And when I'm saying AI readiness skills, it's digital citizenship and internet maturity skills, it's creative thinking, it's critical thinking, collaboration, communication, and then mastering AI tools. Irrespective of whatever background you are from healthcare, you are journalism, you are from commerce, you are from any background. These skills are the need of the hour. These skills are important for 99.999% individuals globally. आफ्टर लॉन्ग रिसर्च, ईयर्स ऑफ रिसर्च, आप लोग यहाँ पे ये सेशन अटेंड जो कर रहे हैं ना, कंसिडर योर सेल्फ रियली लकी that you guys are getting this structured skill set. With the help of this skill set, you can understand how you can make yourself AI ready. In the foundation of AI readiness skills, what you have to learn? So in the foundation, it digital citizenship and internet maturity skills. And AI readiness, when I'm saying, don't just think to save yourself from career, it is important. Being AI ready is now a part of your life too. Individually भी आपको AI ready बनने की अब बहुत जरूरत है, because as we say, digital citizenship and internet maturity, these skills give you 3 major competencies. It's very important for you to be online safe. Already बहुत सारे threats हैं internet के, and AI is fueling many of them. So safety first rule applies everywhere. And with all the research we did in last 1.5 years, we structured it, and just this pyramid, AI readiness skills pyramid, is enough for everyone to understand how you build your foundation. Online safety, we will, I am not focusing on this right now because currently we are focusing on career part. And for that, I would like to focus the most digital citizenship and internet maturity skill is online learning. I don't know how many of you have heard the acronym VUCA. There's this famous acronym, VUCA. Full form: volatile, uncertain, complex, and ambiguous. We are living in a VUCA world, जहां volatility है, uncertainty है, complexity बहुत ज़्यादा है, and ambiguity है. And for that, we can't expect कि we will be just referring textbooks and we will be getting reskilled and upskilled. Online learning skills are very important for everyone to become AI ready. आपकी online learning skills जितनी ज़्यादा अच्छी होंगी, it's very important for you to upskill in a period of 15 days, 1 month, 2 months, because now it's reskilling and upskilling is very important in the age of AI, when we are living in AI driven world. And online learning doesn't mean that you are just aware of the current affairs and the general knowledge. If you are getting skilled, whatever it is, if you are getting skilled and if you are learning something new and upskilling yourself with the help of online learning skills, that is most important part. You have to understand how to pick authentic resources. And I'm sure यहाँ पे professors and teachers भी होंगे. There is one big war. What is the authenticity and what's not? Recently, I was also invited in one interview for the NDDV panel, and there are so many doctors were there. People are doing online learning, they are diagnosing themselves. They are just doing searching. There is a difference between online learning and online searching. Online learning skills make you authentic with upskilling and reskilling. And the combination of online learning and online reputation is important. When I am saying online reputation, you have to be visible online. The era is gone where you are doing whatever you want to, just printing 2-page CV. Whatever you are doing right now, ensure that you are visible online. You are showcasing it online. You are doing it in, you can, and also one acronym is also famous, and it's not just acronym, it's a line which is my favorite. In AI era, network is your net worth. These are the skills you need to develop over whatever expertise you are having, over whatever thing you are doing. And the combination of online learning and online reputation skills gives you career insurance. And in order to simplify this too, what is career insurance? We all know there will be multiple threats ahead. AI is going to do a lot of disruption. We all know that. When disruption will hit, many of you won't even end up turning yourself into a health profession. लाइफ में बहुत टाइम, बहुत बार साइकिल्स चेंज होंगी कि आप अपना प्रोफेशन भी चेंज करेंगे और आपकी फील्ड्स भी चेंज होंगी. And when that will happen, these are those skills which will ensure your career insurance. कि जब लाइफ में करियर वाइज किसी का एक्सीडेंट होता है ना, कि अब तो वो फील्ड ही चेंज करनी पड़ रही है, बिकॉज इट्स वेरी इंपॉर्टेंट टू अंडरस्टैंड एआई इज इवन वैनिशिंग सम इंडस्ट्रीज. बीपीओ इंडस्ट्री टाइप की इंडस्ट्रीज को तो एआई ने वैनिश कर दिया है. But even if healthcare, if you are focusing on healthcare too, you have to upskill and reskill yourself very frequently. You have to show yourself what kind of projects you are working in. LinkedIn, Instagram, Facebook, you have to be very good in with your online reputation. And if you are very good with these two skills, you are career insured. Another level. I'm sure बहुत सारे लोगों many times whenever I meet my students, they are in this doubt कि हमारी जो field है वो AI safe रहेगी या नहीं, whether it's healthcare or whether recently मेरा एक session School of Engineering में था. So they were saying हमारी field safe रहेगी क्या नहीं, AI is coming to do job losses, and also there is doubt कि AI will replace all humans, job losses will happen. This is the answer of all questions. किसी को ये जानना है कि AI safe उनकी job है या नहीं. Anyone wants to be AI safe, that they will not get replaced by AI. They have to develop very strong 4Cs. And when I'm saying very strong 4Cs, in this AI readiness skills pyramid, there is no single skill which is negotiable that you can skip it and you will becoming AI ready. And this is the rule that you go from bottom to top. First, you strengthen yourself with digital citizenship and internet maturity skills. This in itself is a subject. Then you strengthen yourself with 4Cs. But ये curriculum का तो part नहीं है. How we will be strengthening these skills? Creative thinking skills. You have to be innovative and creative all the time. You have to do collaboration, communication, critical thinking. These are the skills which humans are lacking, and that's why repetitive task अगर कोई भी है, and any human who is working with the repetitive task, it's sure that repetitive task में these 4Cs are not used. तो अगर आपको कभी भी ये आइडेंटिफाई करना है कि आपकी जॉब एआई सेफ है या नहीं, जस्ट टेक अ पेन एंड पेपर एंड जस्ट थिंक एंड जस्ट एनालाइज कि क्या मेरी जॉब में क्रिएटिव थिंकिंग काम आ रही है या नहीं, क्या मेरी जॉब में कोलैबोरेशन स्किल्स यूज हो रही हैं या नहीं, क्या मेरी जॉब में कम्युनिकेशन यूज हो रहा है या नहीं, क्रिटिकल थिंकिंग यूज हो रही है या नहीं. एंड दैट्स हाउ यू मेक योरसेल्फ एआईज बॉस. क्यों स्किल्ड प्रोफेशनल्स की कमी है आज? Why we are still in such a big country, so many graduates are still unskilled and recruiters can't hire them? Because we are lacking in these skills, which makes us more human, and it's important to be more human that way. So this makes you AI's boss. अगर आपको AI का assistant बन के replace नहीं होना है, so these 4 आप इन्हें प्रोजेक्ट्स करके करोगे, इंटर्नशिप्स करें, प्रोजेक्ट्स करें, do as much projects as you can. Creative thinking, try to think new every single time. इन 4Cs के बीच में आप अगर AI का यूज कर रहे हैं, so you are already killing your most human skills which will make you AI ready. इन 4Cs पे AI का यूज नहीं करना है, इनको स्ट्रेंथन करना है. लास्ट नॉट लीस्ट, ऑब्वियस है, इन स्किल्स को स्ट्रेंथन करने के बाद, इन स्किल्स को समझ लेने के बाद, नाउ यू आर रेडी टू यूज एआई टूल्स एंड अंडरस्टैंडिंग डेवलप करो कि एआई टूल्स और एआई टेक्नोलॉजी को कैसे आपको यूज करना है. एंड फॉर दैट इट्स वेरी इंपॉर्टेंट टू हैव आउटपुट क्लैरिटी अराउंड एनीथिंग. I give my example. I worked in journalism for almost 6 to 7 years. And now because I have worked, and मेरे टाइम पे AI नहीं था इतना जब मैंने अपना जर्नलिज्म किया है. So now I know how to write. I am expert in that, how to write. But now when I will be using AI tools, इट्स ओके बिकॉज आई नो हाउ टू राइट. बट अगर मैंने इतना एक्सपीरियंस लिया ही नहीं है, मैंने स्टोरीज या फिर न्यूज या फिर आर्टिकल्स लिखना सीखा ही नहीं है, एंड देन आई एम यूजिंग एआई टूल्स, how I will be justifying that whatever I did right or not? Ensure that you must have output clarity कि आपको करना क्या है AI tools और tech के साथ में. And for that, it's important to understand workflows. कि आपके किसी भी टूल एंड टेक को यूज करने के लिए आपका वर्क फ्लो क्या होना चाहिए. देर इज वन स्टैंडिंग ऑपरेटिंग प्रोसीजर्स कि हाँ इस टूल का यूज करना है आपको, एंड देन यू विल बी गेटिंग द रिजल्ट यू वांट, एंड द चेनिंग ऑफ टूल्स एज वेल. बट this is the last stage where you use AI tools, not before. First understand, did you learn online, did online learning in a good way? आप क्या ऑनलाइन लर्निंग स्किल्स में अच्छे हो गए, आपने वो सीख ली है स्किल? Then are you good with your online reputation? Are you implementing 4 C's to ensure the output clarity, the workflows, the SOPs, the chaining of tools? Then only you have to use AI tools. मेरे पास बहुत सारे ऐसे क्वेश्चंस आए हैं जिसमें ज्यादातर हाउ टू डू दिस, हाउ टू डू दैट, हाउ टू डू, ये सारी चीज पे बात हुई है. बट आई स्टिल फोकस ऑन दिस पॉइंट. इन AI ड्रिवन वर्ल्ड, फर्स्ट अंडरस्टैंड एंड फर्स्ट आंसर व्हाट एंड व्हाई. आपको क्या करना है और क्यों करना है, पहले इसका आंसर की क्लैरिटी लेकर आओ, एंड दैट देन स्विच टू हाउ पार्ट. आई नो टीनेजर्स एंड यंगस्टर्स आर डूइंग जस्ट वन थिंग. They just want some tool is coming and they just want to jump into that tool and how it's working. But it will not work like that. You will never become AI ready if you are directly jumping in the how part. I think Shivani is saying something, how AI affected pharmacy and how it can. I will be answering these questions if time will allow. But this is the QR code you can see. We published a white paper. So anyone who wants to read AI readiness skills in detail, I will give 10 to 15 seconds, and you guys can scan the QR code, and you can also download it and you can read it, why these skills are important and how it make you AI ready. So I'm pausing for a while, for like 5 to 6 seconds. Okay. You can also reach out to me so I can share that too. So crux क्या निकल रहा है? In order to save yourself from threats of AI and want to grow yourself with the opportunities of AI, and यहां पर अपने आप को एक इंडिविजुअल कैपेसिटी से देखो. See, again I will focus. Again I am focusing on this slide. What's the title of this slide? AI readiness skills, a common minimum framework for upskilling humans. It applies for everyone, for every human, how you have to upskill, and this is the bare minimum foundation, the whole AI readiness skills pyramid. It is just the foundation, and top of that you can get so many skills. It can be niche based, it can be because yes, in the era of AI, it's also very important first becoming AI ready, and then developing an expertise in any level. आप किसी भी बैकग्राउंड से हो, आप हेल्थ केयर से हो, आप लॉ से हो, आप इंजीनियरिंग से हो, you have to pick and choose some niche where you are developing your expertise, and after this foundation all the things applies to that expertise level. जब आपको आउटपुट क्लैरिटी आने लगेगी, एंड दैट्स व्हेन यू क्रॉस वन लेवल ऑफ फाउंडेशन ऑफ AI readiness, and then you start the journey of becoming AI ready. So these are the skills. Keep you can pick off this slide. Remember these skills, how you have to save yourself from threats of AI. These skills will be saving you from threats because you will be doing critical thinking, where the society is going, where the development is going. And you will be also able to understand how you have to reskill and upskill. And with the implementation of 4C's, you will be understanding कौन सा टास्क रिपीटेटिव है एंड कौन सा नॉन रिपीटेटिव. इसको और सिंप्लीफाई करने के लिए, ड्राइविंग कार्स, इट्स रिपीटेटिव. इट्स सेम, इसकी एक एसओपी तैयार हो गई है, अब इसको बार बार ऐसे ही करना पड़ेगा. So, as good as driving cars to as good as doing brain surgery. If it's repetitive, अगर उसका SOP तैयार हो सकता है, AI will definitely replace. And the only thing which will be saving us will be these AI readiness skills. So as I said, these skills are very important. So I feel the way technology is developing, it's high time for every student, and especially in the education industry. I am working for education industry especially, and I am on AI readiness skills mission. So in this mission, we are providing AI readiness skills to 10 million students and 1 million teachers of India. And उसे भी मैंने बहुत ambitious timeline दी है, and that is of 2028. I really wish, I really want India to be AI ready, and being a part of mission, I think this is the most important mission for now to give AI readiness skills to these number of students and teachers. No matter अब हम उसे कैसे कर रहे हैं, so we already developed a toolkit. हमारी schools के लिए एक toolkit already बन चुकी है. For colleges, we prepared a fair policy. Colleges की toolkit बन रही है, and with that we are enabling. You can also download it from aireadinessskills.com, और यहाँ पे आपको स्कूल की कॉलेजेस की सारी टूल किट्स मिल जाएंगी. एंड विथ दिस वे वी आर enabling this mission to make India AI ready. Now, with this mission, this is one dream of mine, and that personal dream, to see India as AI use case capital of the world. And it's only possible when everyone like you, teenager and youth, are coming forward. So we developed a show. It is India's Got Intelligence. So anyone, if you are working on any kind of AI use case project, it can be in any field. I would love to publish your story. It is also taking a shape of a show. So soon we are going to organize it. But मेरी already India's Got Intelligence stories का project शुरू हो गया है. I am already covering so many kinds of projects, AI use cases. Some are related to healthcare, some are related to law. So I invite every one of you to be a part of India's Got Intelligence and be the part of AI Readiness Skills mission. Now, what we want, this is also what very important thing to say. There are healthcare professionals here. As I said, currently I am working for AI Readiness Skills mission. So we are working in the education industry. So we developed a framework for teachers to be AI ready. But now what we want is, we want to develop a core AI readiness framework for healthcare professionals. I will just show you one screen. Here you can see framework for AI readiness of teachers. This is the thing we were working, and we already created this framework for teachers. There are these 5 C's role, and if a teacher is good with these 5 C's role, AI can never replace them: the creator, curator, conductor, coach, and counselor. So we prepared this for teachers, and similarly, in the same way, we want some experts from healthcare. See, I am not from healthcare background. I am from AI readiness background. So we want healthcare professionals to come forward, participate. Any one of you, we can develop AI readiness framework together, and we can give clear cut way how healthcare professionals can evangelize the way I am doing in the healthcare fraternity, and how they can say how skilled professionals are there. And also, I think the AI readiness framework for healthcare professionals is also important, because public awareness is also a very important part. There are some times when I feel कि public को aware करना इसलिए जरूरी हो गया है, because they are too much on AI, and when they are trusting too much, वो problems भी लेकर आता है. अगर एक expert AI पर भरोसा कर रहे हैं, so they know the niche, they are expert in that niche. But if a person like me, if I am diagnosing myself, फिर तो दिक्कत ही है. So that's why I feel that this AI readiness framework is very important, especially to aware citizens. And my other ask is, I really want AI readiness ambassador for healthcare domain. आप में से जो भी हेल्थ केयर नीश में हो, यू बिकम एआई रेडनेस एम्बेसडर, you promote, motivate healthcare professionals in the healthcare domain to become AI ready by applying these skills and getting expertise in whatever domain you are in. So if you are interested, me and my team would love to have you on board, and we are really very excited and looking forward to make this AI readiness skills mission a success. This is me. You can reach out to me on LinkedIn. I am already accepting so many messages on LinkedIn, so you can reach out to me if you want to be a part of mission. Just be. And if you are becoming AI ready with those AI readiness skills, that's the time I say you are a humans winning AI. So I think that's from my side. If there are any questions and answer, I would love to answer them. And although there are some limitations of me, I am AI readiness evangelist, so I would try to answer any questions of yours.
Yes, ma'am. एक personal question था प्रीति का. So प्रीति wants to know कि जो small clinics होते हैं या individual कोई practice कर रहा है, तो वो AI को कैसे use कर सकता है अच्छे से effectively without any huge investment.
प्रीति ने क्वेश्चन किया है कि एआई को क्लिनिक्स में कैसे इफेक्टिवली यूज कर सकती हैं वो. सो आई विल से द बेस्ट पर्सन टू how she can use AI in clinic effectively is the one who is expert in that field. As I said, जो भी डॉक्टर्स हैं आपके सीनियर प्रोफेशनल्स हैं, बिकॉज इवन इन माई सेशन आई सेड कि आपका अब जो हाउ पार्ट है वो इंटरनेट और एआई खुद ही सॉल्व कर देगा. जस्ट राइट अ गुड प्रॉम्प्ट, एंड मैंने तो ये बात मान ली है कि एआई इज बिलियन टाइम्स बेटर देन अस. I don't have any answers, but AI is having answers. So yes, you just write a good prompt how you can use, because I am not an expert. I am not from healthcare background, so I think I'm not the right person to answer.
Ma'am, one more question. Do we need to certify to use AI in physiotherapy assessment or management? Excuse me, ma'am. Ma'am, you are not audible.
Am I audible now?
Yes, ma'am.
Yes, you're audible.
Okay. I think there are also so many questions. Okay, so physiotherapy certified. I think PDF Care is more aware about this. Is it important? There are some. There must be some criterias, I guess, in the healthcare where students need to get certified, because if you are using AI, you have to be that good, right? After all, you guys are dealing with health, right? So maybe in future, if curriculum allows, so it's possible. I am not aware about the healthcare industry, to be very honest. I am from journalism background, and I am an AI readiness evangelist. So if there will be any questions with the AI readiness thing, I will be love to admit all of that. I think some are already what's your take on physiotherapy stream? Yeah, this is one good question I would like to take. It is by Antara, and getting affected by AI cause physio is on hands. So love to hear your perspective. Great, Antara, this is a good question. And physiotherapy stream, see, even in physiotherapy, I think you have attended Negi sir session, and even in physiotherapy, so many things are coming in. Okay, so if you are doing physiotherapy from some tools which is repetitive, so you can apply. If that thing is repetitive and it can be done with the help of machine. I was watching his session. He is working on some spine related things. So in that way, physiotherapy will also, AI will also come in physiotherapy. And sooner or later in the assistant role, it will come. But when I'm saying 4 C's and something which, see, this is one good thing I want to convey here. अभी जितने भी टास्क बहुत ज्यादा फ्लेक्सिबल वाले हैं, वो अभी इतने अच्छे से रोबोट्स नहीं कर पा रहे हैं फॉर नाउ. बट मुझे नहीं पता वो कितने अच्छे से फ्यूचर में करेंगे, क्योंकि फॉर से पेंट वॉश जो अपने पुताई करने वाले लोग होते हैं, या फिर मैकेनिकल का काम करने वाले, गाड़ी सही करने वाले, प्लम्बिंग का काम करने वाले, अभी करंटली ये एआई से फील्ड है, क्योंकि आपको समझना पड़ता है कि कहाँ पर कौन सी प्रॉब्लम हुई है मशीन्स में. सो इफ फिजियोथेरेपी इज लाइक दैट पार्ट इज सेफ. बट इफ इट इज कमिंग विद द टेक पार्ट, जहाँ पे आप डायग्नोसिस अच्छे से कर सकते हो विद द हेल्प ऑफ टूल्स, तो अगर आपकी एक्सपर्टीज है कि बस आपके ही हाथ से वो फिजियोथेरेपी अच्छी होगी, आप उस नीश में एक्सपर्ट हो, then it's safe, I will say. Otherwise, assistant role will be taken by AI soon. So expertise is very important. Now you can't just say कि जनरलिस्ट अप्रोच अपनी रख लेते हैं. अगर हम जनरलिस्ट हैं, थोड़ा बहुत हमें पता है एग्जाम्स वगैरह, हाँ, दिस इज फॉर ऑल स्टूडेंट्स. इफ यू आर क्लियरिंग योर एग्जाम्स, मेक श्योर यू आर रीडिंग फ्रॉम ऑथेंटिक बुक्स. प्लीज चैट जीपीटी के आंसर्स एग्जाम में मत लिख कर आइए. इट्स जस्ट ट्रेंड सेट, ट्रेंड मॉडल जो बहुत सारे रिसोर्सेज का ट्रेन किया गया है. डू सर्च द ऑथेंटिक सोर्सेज. अनदर क्वेश्चन आई कैन ऑल्सो सी इफ टाइम इज अलाउइंग मी. व्हाट्स योर, अंतरा का क्वेश्चन हो चुका है. डू यू हैव सम प्रोग्राम्स फॉर सर्टिफिकेशंस ऑन एआई फॉर अस? सी, फॉर विद अस ह्यूमंस विनिंग एआई, वी आर onboarding students so they can do projects with us. So we are already certifying them on AI readiness. So if they want to become AI ready, they can work with us and they can become AI ready. How is AI used? And I think that's from all sides. Sakshi, if you have some questions from your side, you can just ask.
No, ma'am. Thank you so much.
Yeah, with lot of audible and inaudible. Finally, the session was better in the second half.
Yes, ma'am.
Yes. Okay. Yeah. Thank you so much. Okay.
Thank you so much, ma'am. It was such
Yeah,
a
pleasure is all mine.
informative session.
Thank you so much.
I
Pleasure.
would like to say something, ma'am. Your presentation was very good, and I
Means
took your
a-
some of slides without your permission. So your
Sir, you
presentation
want me
was
to
very
send you? I will
nice.
send you. Thank you, sir.
Yeah.
Thank you so much.
So it was
Really, really
very
means a
nice.
lot to me.
And ma'am, if we want to collaborate, because I am working in a department of clinical embryology, here we are teaching students about the embryology department. So can we collaborate in any kind of project that, in like there are some genetic disorders also there, because if students are working in this particular field, because it's now emerging area, right? The clinical embryology in India now, every university is starting embryology, right? So before going to IVF, there is a one technique, in vitro fertilization. So there must be some genetic test which is required, right? So
Okay.
now AI and IVF is incorporating, the IVF people, they are now checking, also doing checking with the help of AI now, because now every field they are incorporating AI in their field, right? Whether it's hospital
So, sir,
setup or it's IVF. Yeah.
I would love to collaborate in this, because we are really, really aligned to this mission, AI Readiness Skills mission, and because you are expert in the field, so with this collaboration, you will bring the expertise, and we will bring the expertise of AI readiness. So it will be great. I will be aligning. I will just take connections from Sakshi and the organizers, and we can definitely collaborate in this, and it will be win-win for India only.
Thank you so much, ma'am, for your presentation and
Pleasure
awareness.
is all mine. Pleasure is all mine, sir. Pleasure is all mine. Thank you, sir. Thank you so much. Okay.
Thank you so much, ma'am.
Yeah.
We are pleased to welcome. We are pleased to welcome Pulkit Gautam, PhD scholar, Department of Gastrointestinal Surgery, HPV and Liver Transplantation, PGIMER, Chandigarh. Now over to you, ma'am.
Thank you so much. I'll be sharing my slide. So, could you please stop presenting? Can you please stop presenting?
Is it okay, ma'am? Just 1 second. I think
Yeah.
it's done.
Yeah.
Yeah. I'm so sorry. Yeah.
Are my slides visible? All right.
Yes, visible.
Okay. So, hello everyone. My name is Pulkit Gautam, and I am a PhD scholar in PGI Chandigarh. And today we'll be talking about AI in surgery and clinical research. So, if you look at it, a lot of details have already been discussed by the previous speakers, and they've talked about different technicalities. We've talked about physiotherapy, we've talked about diagnostics, we've talked about AI readiness, as should be very in detail. She explained to all of us very nicely as well. So, um, so now we'll be coming to a bit more technical aspect. My slides will be technical and I'll be going into more details of how AI is being used, specifically in terms of surgery and in terms of clinical research. So to begin with, let's look at this. When we look at this slide, whenever a patient comes in the hospital setting, there is a lot of data that is being produced, right? So whenever the patient is coming in, you look at that there are certain, we get a card made, for example, we get it registered in the electronic health records, we get certain numbers that are marked. When the patient comes in, there will be certain diagnosis, there will be certain tests that will be run. So we'll have certain medical images, we may have certain blood tests and all. Further, we may prescribe certain medicines or something, so pharmaceutical data would be produced. There could be certain health claims, insurance claims that happen, that sort of data. So there is a lot of patient data that is being produced whenever a patient walks into a hospital or in a healthcare setting. This amount of data, we obviously, healthcare professionals, they'll pick whatever information is required, but there is a lot of information that is still not being extracted from it, a lot of information that can still be extracted from it. And that is where AI comes in. So in this slide, you'll see that all of the data, different information is coming from it. So for example, when you're talking about improved healthcare access, or when we're talking about customer service chatbots, or for example, when you're talking about management of medical records. So whatever EHR records we have, all of that comes together and that is being used in AI, that's being used in healthcare to improve access, to improve medical records. If we're looking at something such as, for example, we have images, a lot of imaging data we can use it for automated image diagnosis, we can use it for accurate cancer diagnosis. Other than that, in surgery as well, for example, we have robot assisted surgeries, right? So it gives you a lot more precision, it gives you a lot more accuracy when you're performing any surgery. We'll come into details with all of these different aspects in the upcoming slides. So to begin with, this has been covered by everyone, but still just to put it out there. If we have to define artificial intelligence, it can be defined as the study of any algorithms that allow the machines to have ability to reason or to perform any cognitive functions, much like human beings. For example, they have to problem solve, but they have to object and recognize words or any sort of decisions that have to be made. So within AI, we can have a lot of different subsets, which in this case, what we will be looking at are machine learning, deep learning, and some aspects of natural language processing. So, like we talked about, artificial intelligence can be broken down into a lot of subsets. The first one is machine learning, something that I'm sure that all of you have heard at some point in time. Even in some of the previous slides, we looked at machine learning. Deep learning is an aspect of machine learning. Other than that, we have natural language processing, we have speech recognition, we have robotics, we have certain visions. For example, you would have heard about virtual reality, VR, augmented reality, AR, that sort of thing. So vision is there, right?
Excuse me, ma'am. We are able to see your image. It is stuck on the first slide. Yeah.
Okay, all right. Has that changed?
Thank you, ma'am. Now it's
Is it coming in slideshow view?
no, ma'am. Actually, other background.
Okay, give me a minute, please. Is that better?
Yes, ma'am. Yes, ma'am.
Yeah. Cool. All right. Is it changing now, or is it still stuck?
No, ma'am. It's
All right, good enough. Okay. All right. So basically, we talked about artificial intelligence. We defined it a little. We looked at the different subsets of artificial intelligence. And the first thing that we're looking at is machine learning. So machine learning, to define machine learning, ML models analyze data to identify patterns and make predictions or decisions, enabling automation and efficiency in various tasks. So any sort of data that is being provided to the specific model, it will identify certain patterns and it will try to make certain predictions out of it. There can be different types of machine learning. So we can have supervised learning, we can have unsupervised learning, and we can have reinforcement learning. In that, let's look at it with an example, right? So, for example, this is a very basic example of where ML is being used. What you're simply doing is in supervised learning, if you look at it, in the first step, you're training the data, you're training the algorithm. So you give it certain images. You tell the algorithm that this is a gallbladder, right? And once you've trained that algorithm, then you come back and you give certain testing data. The unlabeled data, using the unlabeled data, the algorithm can then further identify if that image is a gallbladder, if it is not a gallbladder, as you can see here, right? On the contrary, if you're looking at unsupervised learning, you're not training something specific. You're not telling the algorithm that this is what we're looking for. You simply feed the algorithm a lot of different images. And the algorithm will look at all of the images, parse through all the images, and then identify certain patterns in it. For example, in this specific example, if you see, in all of the other slides, we have a composite system, while in one specific image, we're looking at a certain bleeding. So that is what it will identify, that in all of the images, there are certain organs that are present, but in one specific, there is a red region which identifies as bleeding. So that becomes supervised learning and unsupervised learning. When we're looking at deep learning is an aspect of machine learning. So I'm not trying to get very technical. I'm simply trying to introduce you to the different aspects of, you must have heard a lot of different terms, like you've heard machine learning, you've heard deep learning, but what exactly is it? So that aspect is what I'm trying to get in. We'll get into the examples later, right? So deep learning is a subset of machine learning, and it is majorly used for artificial neural networks. So when we say artificial neural networks, you understand that within the brain, the human brain has a lot of neurons, and the neurons form certain neural networks which help us in cognitive learning, right? So if we are producing an algorithm that is replicating a neural network, we call it an artificial neural network. This image here gives you a major idea. So the circles are the different neurons and they are interconnected with each other. When we give a particular input to the neurons, it flows through different channels and certain mathematical functions are performed. These mathematical functions then translate into a certain response, usually in a 0 or 1 binary response, that will then allow us to reach a specific conclusion, or that will give us an output. Okay, so now that you have a basic understanding of the different terms that will come up in the future, let's get into the examples. Let's dive into the examples. So much like the slide that we looked, the second slide that we looked at, where can AI be applied in healthcare? So we're looking at medical imaging, for example, in tumor detection. We're looking at drug discovery, any sort of personalized medicine, any virtual assistants, or any predictive analysis. To go into more specificity, so my topic was AI in surgery and research. So we'll break the slides, we'll break this session into 4 sessions. When we're talking about surgery, the surgical part can be split into 3 different sessions, let's say. The preoperative part, the surgical part, and the postoperative part, right? So let's look at the preoperative part. In the preoperative phase, there can be different uses of AI. Primarily, we're looking at imaging analysis. So for example, we have different images and we can perform tumor segmentation. We'll get into details about that. We can look at surgical planning. So we have a specific case and we have to understand that how can we plan the surgery? What can be done? Taking into consideration the specifics of the patient. So for example, if there will be specific blood loss, if they have any sort of blood disorders, so that could be a reason. Certain complications that can come up and things like that. And further, we can have patient stratification. So any specific risks, again, that can be identified in the preoperative phase. This is an example of a neural network. And a part of the neural network is a type of neural network is a multi-layer perceptron network, and it can be used for diagnosis. So if you look at this image, you're looking at the different inputs, you look at a network and the outputs, right? So within the inputs, you can have different aspects. You can have symptoms, you can have biochemical analysis, image analysis, and other different properties. So for example, I am working on pancreatic cancer. So if you look at a patient that comes in that is having pancreatic cancer, that has to be diagnosed with pancreatic cancer, and we have to use this particular perceptron network for diagnosis, what we look at is the patient's symptoms. So a patient with pancreatic cancer will usually come up with abdominal pain. He will come up with fever. So we'll have abdominal pain, we'll have high temperatures, we'll have fever. In terms of biochemical analysis, the patient will come up, they'll have high ALP levels. If you have done any sort of biomarkers testing, right? So CA 19.9, for example, will be raised. Bilirubin will be raised because a patient with pancreatic cancer will most likely have jaundice. Then we might have certain image analysis. So in the MRI and within the CT, you will be able to identify certain lesions in the pancreatic region. And finally, other properties. So age, weight, and sex may not be as relevant, but certain things, for example, substance abuse. So if a patient is an active smoker, if a patient is an active alcoholic, all of these factors will together combine, and this neural network that has been trained on previous data will be able to identify that on the basis of all of these inputs, the patient can be diagnosed with pancreatic cancer. So that is a very simple example of how neural networks can be used for diagnosis. This is a different aspect. Therein, in the previous example, we were looking at how different symptoms are being used, how all of the clinical aspects that we have are being used. In this particular image, in this particular slide that you're looking at, this is a breast cancer diagnosis slide. And they're looking at early diagnosis. How can we make early diagnosis? Because you'll understand that we're talking about cancers. Early diagnosis is very important, right? So in this particular case, what they did was, all of these are research papers, all of this is research that has been presented and published, and I have all of the references at the bottom of the slides. So if you want to read the paper, you can do that. Anyhow, so in this particular study, what they did was they had normal images and they had microcalcification images. So before the tumor starts developing, we have certain microcalcifications that can be seen in the imaging data set that we have. So they fed this particular data set. They had four databases that they worked with: ResNet 50, PGG16, GoogleNet, and AlexNet, right? So all of these data were fed and to all of these different databases, and CNN training models were developed. CNN is convoluted neural network, which is also a type of ANN, right? So on the basis of that, we had all of the model A1, I1, K1, all of that. The ones which were basically normal imaging data, and all of the two models were the microcalcification imaging data. These models were further assembled, and when these assembled models were then worked on with, when testing data was fed into these models, then we are able to identify if there is any microcalcification or if it is a normal image, right? So once this training model, this ensemble model has been prepared, we put in any sort of testing data, we'll be able to identify if there is any microcalcification. And if there is a microcalcification present, we can further test, we can further check if the patient has breast cancer or not. So that will help in earlier diagnosis, right? This is another paper. This is a March 25 paper, if I'm not wrong. So very latest here. What they did was they performed pancreas segmentation and on CT data set, and they used it for early cancer detection. So if you look at the flow chart here, this is a screenshot of the paper that has been published. But if you look at the flow chart on your right hand side, you'll see that the 3D NNU net is a neural network. Is a type of a neural network that allows for segmentation of images. So when I say segmentation, what basically means is that whenever you have for example, let's say we are talking about CT here, right? So whenever we have a CT image, what we do is we annotate data. So for example, a CT image is there and we know that this particular patient has cancer and this is normal pancreas. So we annotate that specific image. We ask the radiologists to tell that this is the normal section, this is the specific lesion, this is, for example, this is the artery, this is the veins, this is the lymph nodes that are involved, that sort of aspect. So a lot of times this is done by hand. This is a manual process. But when you're talking about UNet, it is something. NN UNet is also manual, but NN UNet is something that is automated. So it allows automated segmentation. Once we have segmentation, we further train the model. So we split it into 5 different sections. We have a 5-fold cross validation, and we run this training model for 1,000 epochs or 1,000 cycles. then we average these 5 models, and thus we have a specific model, which is then has certain mathematical functions. These mathematical functions, like I mentioned in the previous slide, so dice plus cross entropy loss is something that they did in this specific paper. And they look at different image modalities, different image modifications. On the basis of that, they reach a certain model. And using this model, in this specific case, they had about 3,000 CTs, a high sample size. And they can use this model to further identify, if you put in CT images as test data, you'll be able to identify if this patient has cancer, if this patient does not have cancer. So that can be a really useful tool, a really useful model for identification. Then we have AI in surgery, which is the second part, the intraoperative phase. So within the intraoperative phase, we can have robotics, surgical robots that can help in that can help in precision, AI assisted precision, as it says. So Da Vinci robot is one of those examples, and we'll be talking about it. The other one is computer vision. We can have AR overlays, augmented reality overlays. We can also have decision support. So we're talking about AR overlays, basically simulation sort of things we're talking about. So we'll talk about Da Vinci robot here, which is the Da Vinci surgical system is a surgical system that is being used in PGI currently for different surgeries. And what it basically does is it is not entirely automated. It has certain sections. The surgeon plays a part. So there are a lot of, you'll see that there is a surgeon console which is not visible in this particular image, and then you'll see that there are a lot of different hands that are projecting out of the body of the system. And in these hands we can hold different tools that will be used by the surgeon during the surgery. So if this is a robot, how does AI come in? Because the surgeon is the one who's actually operating the robot, right? So how does AI come in? So in AI, what we can have is we have motion scaling and tremor reduction. So for example, when the surgeon is working, there could be certain tremors in the surgeon's hands that could lead to an imprecise dissection, right? So that kind of thing can be reduced, or that can be absolutely eliminated when you're using an AI, you're using a robotic system. Other than that, you can have computer vision assistance. So, for example, when you're looking at, if you're performing GI surgery, you have a lot of organs in a very small cavity. So, to reach a specific section, for example, when you're talking about pancreas, as it is a visceral organ. It is hidden. It is hidden, and there are a lot of organs that are surrounding it. So, if you're not able to reach a specific section that has to be resected, computer vision can help you that. So, it will provide you 3D visualization and enhanced, enlarged image of the region that has to be worked on, that has to be resected. So that is something that is there. And finally, data-driven optimization. So whenever any procedure is being performed, this is something that comes as part of a simulation. So the surgeons, the residents can learn from this. So data-driven optimization, when we're talking about, so the system will learn from the thousands of procedures that have been performed previously by different surgeons, and on the basis of that, it can predict what are the possible errors that can happen, and can thus help in decision support in the future. Then we reach the post-operative phase. So in the pre-operative phase, we were looking at diagnosis, we were looking at image segmentation. In the operative phase, we're looking at how surgery can be made easier, made less invasive, using robotic systems. Then we come to the post-operative phase. Within a post-operative phase, majorly, the most important thing for a surgeon comes up is predicting complications. Any sort of complications that might happen in the patient that could become problematic to the patient and for the surgeons to handle. So for that example, one I have mentioned here itself, wherein what they did was, this was a very basic research where they used electronic medical records or electronic health records from the previous cases, and they looked at how the prognosis of the patient happened after surgery. How did the patient respond until they were admitted, for example? And on the basis of the different words and phrases and the different lab reports that were there for that particular patient, they were able to suggest if there will be an anastomotic leak after colorectal resection. So the specific study was performed on colorectal cancer patients, and after the resection, would there be an anastomotic leak? That is what they checked. This is another study that was performed wherein spinal surgery was performed, metastatic spinal surgery. So the vertebra were resected, So in that particular aspect, they're looking at any possible post-operative complications. For example, there could be any infections that might happen, stroke might happen, or anything, any bleed that might happen, that sort of thing. So for that, they created this specific model. So they looked at the different. So the first part is data collection. They're collecting clinical data. They're looking at the different databases, and they're engineering data in the manner that would be required to develop this specific model. They had 379 patients that were used for this model development, out of which 70% were in the training group and 30% were as validation group. And then further machine learning was performed. Machine learning was used to develop this particular model. So linear regression was there, a random forest method was used. Other than that, neural networks were developed. So a lot of different aspects happened. And all of those combined produced a model that allowed predicting the performance of the patient. And further, this model that was prepared to predict the performance was then turned into an AI application, which is an even helpful thing for a surgeon if you look at it. Because not only are they able to predict that what would be the response of the patient, but they're also able to look at it in their own mobile device. So that becomes very easy, and that really makes it easier for the surgeon to for patient care to ease the situation of the patient. So this is an example. I could have gone into more details, but I did not want to bore you with it. But this is the paper that is there. If you want to get into further details, you can. So now that we understand surgery, the next aspect is AI in research, in clinical research, in clinical settings. So what are the different applications of AI in research? So a lot of you might be working on research, and for me, primarily there were two aspects. One was pharmaceutical aspect, and the other was multi-omic approach. These are the two major data sets that most people are working on right now. So I think a lot of questions were also asked in terms of how AI can be used in pharmaceutical industry and pharmaceutical departments in development, that sort of thing. So I hope that this answers your questions. So when we're talking about AI in research, we're saying, first of all, look at this. Applications of AI, we're talking about pharmaceutical product management. That is one thing. You already have a product in the market and you have to position it right. You have to predict that what is your customer base, how many patients are there for the specific disease that will be consuming the specific medicine. And on the basis of that, you can predict if it will be useful, how, where you need to, where is the highest customer base and what could the possible costing and that sort of thing. The second thing becomes drug discovery. So drug discovery is an up and coming field. It has been explored highly and is still being explored in great depth. So we're looking at drug discovery, we're talking about drug design, we're talking about drug screening. So here you're talking about target protein structure prediction. We may look at de novo drug design, any sort of drug protein interaction, any protein interactions. We're looking at any that is drug designing. And if you're looking at drug screening, so any toxicology that might be present, any sort of physiochemical properties that may be required, so that the drug that has been designed and that has been developed does not have any sort of side effects that is not problematic for the patients. Further, we can have pharmaceutical product development, we can have manufacturing. So the manufacturing aspect can be automated and it can even be personalized, which again ties up with drug discovery. We can further have QA and QC parameters that can be set using AI, and further we can have clinical trial designs and monitoring. So we can have enrollment and selection, which in itself is a very hectic task. So we can plan out the clinical trial. How do we want? What do we want? That sort of thing. So AI plays a very important role in research, and it can fit in a lot of different aspects. When we look at this next slide, this kind of gives you an overview. This is just one example. There are a lot of different examples, but I hope that this can sum up to some extent how AI is being used in research. So if you look at it, it says this specific diagram presents an end-to-end deep neural network explicitly modeling asymmetric information flow from DNA to RNA to proteins to metabolites and ultimately to the organismal phenotype. So what it is saying is that they have developed a neural network. If you look at it says that you have cell foundation models, you have molecular foundation models, and you have certain perturbations. So what we're basically doing is we have multi-omic data. We have genomic or epigenomic data, we have transcriptomic data, we have proteomic data, and finally we have metabolomic data. This genomic or epigenomic data can be used to identify, let's say, DNA methylation. This particular aspect then can be transcribed to look at the transcriptomic data, which can help in identifying differential gene expression, which can further be translated into proteins, proteomic data that helps in understanding and identifying post-translational modifications. And further, we look at the metabolomic data, the metabolites that are interacting with the proteins, to study metabolite flux. Okay. And all of this data can have different applications. For example, on DNA, we can have CRISPR technique that we might use. On RNA, we may have RNAi. In terms of proteins, we may have different chemical interactions that might happen. In metabolites, for example, we might look at microbiome, how the microbiome is interacting with metabolites, and that is changing metabolite flux. And all of this can together be used to identify how it is presenting in different phenotypes or genotypes within the organism. In this particular case, any sort of organism, if you're talking about humans, or if you're working with animal models, so maybe rats, mice, all of that, right? If I'm talking about myself, the last aspect, the microbiome and the metabolomic data and the metabolite flux, that is the aspect that I am working on in my PhD thesis. So, what we're basically talking about is, for example, if you look at, let me give you a little bit of details. So, whenever we have any sort of tumor, right? So, the tumor, and there is a tumor microenvironment. So within the microenvironment, there are a lot of different cells that are present. There are different organelles that might be present. We have extracellular matrix, all of things. But in addition to that, we also have different microbes. As you might already understand, that we have a microbial population present in the human body. So even in the intratumoral setting, we have different microbes. And these microbes might interact with the tumor and the tumor metabolites, and that can lead to that can have a significant impact on the treatment of the patient. How does the patient respond to the treatment that is being provided to them, uh, in terms of surgery as well as in terms of chemotherapy or radiotherapy? And the interaction of the microbes with the metabolites can lead to a change in metabolic flux. When we say metabolic flux, we basically mean there are different chemical reactions that are happening, and within the chemical reaction, the translation of the chemical reactions when it is happening. So when the product is being formed, there is certain flux that is happening, that is flowing through the reaction. So whenever the metabolites are being produced, there may be changes in the flux. On the basis of the microbiome, how can it bring changes in the metabolic flux is something that can be significant and can be a future aspect of AI that can be used here. So that is all. We kind of looked at how AI is helping in surgery, how AI is being used in research, how I am using AI, and how AI is being used in a lot of different aspects. So, any questions? I'll be open to that.
Thank you so much.
Okay. I see that the first question says that, can this be used in cancer surgery? Yes, yes, it can be used in cancer surgery. So, for example, in pancreatic cancer, we have Whipple's procedure that happens, right? So, that is something that is being used at this point in time. Of course, it requires a lot of training on the part of the surgeons. So, for example, initially you start with the lab cholecystectomy, and then over time you keep on moving to different surgeries, because Whipple's is a very invasive procedure. So, but yes, to answer your question very simply, yes, it can be used for cancer surgery. Especially rectal carcinoma and spinal tumors. I need to know, can they be cured by the AI diagnosis and treatment? I'm not going to say cured, because, like every other speaker before me has said, AI cannot replace humans. It is here to assist you. It is not here to replace you, right? So I won't say cured, entirely cured, because cancers can be very unpredictable. But yes, it can help you. So for example, when you're talking about diagnosis, in a lot of in a lot of cases that I present, in a lot of papers that I shared with you guys, you could see that it was helping in early diagnosis. It was helping in early diagnosis majorly, and precise diagnosis. So sometimes you can have, you know, okay, wait. Yes, so it is happening in diagnosis, and it is helping in treatment. So completely cured, probably not, but will it assist in a better treatment and in a better diagnosis? Definitely. Okay, we have what is the significance of using an end-to-end deep neural network for modeling information in biological information flows in biological systems? Okay, so when we're looking at end-to-end deep neural networks for modeling information flows in biological systems, what it basically is helping you is when you're developing a when you're developing a neural network and you're looking at the information from biological systems. For example, the last thing that I was talking about metabolic flux. So in metabolic flux, when we're giving a certain input, when we're telling them this is the interaction that we're looking at, these are the metabolites that are present, these are the cellular interactions that are happening, and on the basis of the metabolic flux that we already understand, there is a certain aspect which is known as genome scale metabolic models that are developed. So genome scale metabolic models that this is exactly what is happening. We have certain neural networks that we include, we develop a certain metabolic model, and through the deep neural network, the biological system, the information is flowing, we're able to see that if this particular metabolite is interacting with this specific cell type, then what is the possible response that we will receive. So for example, if there is a patient that is having chemotherapy resistance, so you'll be able to identify that there is a certain metabolite that is restricting the chemotherapy response. Perhaps it is restricting the chemotherapy metabolism, which is why further it is not turning into an active form, which is not providing a response, which is leading to resistance. So that sort of thing. And what about stroke and paralysis? It helps in better treatment and fast recovery. Yes, for sure. Stroke and paralysis. See, what I was talking about, I think stroke and paralysis, while a part is something that physiotherapy people would be able to help you understand better. When I was talking about stroke and paralysis, I was talking about possible complications. So if you're able to identify, for example, if you're talking about a stroke, if it is not identified the proper time that the patient is going through a stroke, it can lead to paralysis, right? So if there is an early diagnosis, if we are able to identify that this particular patient might have a complication from the surgery and this person may have a stroke, then we will be able to take it into consideration and we'll be able to help the patient earlier and make sure that we're ready if such a complication does arise. So that sort of thing. All right. If there are any further questions, these people will share my email ID, like the organizers, and you can send me the questions there and we can further look into it. And I'll be happy to answer your questions. Thank you so much.
Yes, Shubhi ma'am, you want to ask something?
Ma'am, can I answer just quick one question from you, Pulkit ma'am?
Sure.
Ma'am, how much AI is effective right now in surgery, and how many skilled professors we need in the coming years, especially in the healthcare industry?
Okay. See, as such, for example, this specific system when we're talking about the Da Vinci surgical system that I talked about, we have it in PGI and it was recently set up in PGI and the doctors are currently practicing on it. So the upcoming residents will definitely be well trained in robotic treatment. But the current surgeons, the current professors, they're learning on it, they're working on it, and they will reach that sort of expertise. But as such, so that being said, most of the current surgeons still prefer that because the kind of precision that let's put it this way, when you're using your hands, you've been trained to use your hands all your life, so you
There
understand
is
it a
one
lot better than
mental
when it
block,
comes
we
to a
can
robotic.
say. Using AI, there is one mental
Exactly.
block. Yeah.
Correct.
Okay. And is it coming to
Yes,
curriculum
precisely.
as well? Like, for the students that now it's mandatory to use AI with whatever stuff you are studying and all that, for the surgeries and whatever?
Yes, AI mandatory as such. All of the residents are working with it, so yes, it becomes mandatory. But as such, it is also being AI is also being used in simulations. The Da Vinci surgical system in itself. We also have certain lab Foley systems and all of that, wherein we're using virtual reality, we're using augmented reality to train the surgeons to work even when we're not working on a patient. We can practice and we can learn on the basis of AI simulations, so that when we're working on the patient, we have a real time understanding of how things might work out, any complications that might arise, and such things.
Thank you so much, ma'am. It was very insightful. Thank you so much.
Thank you.
Thank you so much, Pulkit ma'am. It was such an informative session. Now we are welcome our fifth guest, Dr. Sumanta Ghosh, an accomplished physiotherapist professional with an MPT and PhD. Dr. Ghosh served as a chief respiratory physiotherapist at HSPR clinics, Delhi NCR and Assam. And he is also the author of Tidy's book and actively contribute to the research and clinical training in respiratory physiotherapy. Welcome, sir.
Hi, good evening, everyone. This is Dr. Sumanta Ghosh. So, thank the organizers for including me in today's session. So, I will be presenting a brief session on basically how respiratory physiotherapy care is being changed with the application of AI. Hopefully, I'm audible to everyone. If anyone can confirm, if anyone confirm, if I'm audible, guys.
Yes, you're audible, sir.
Okay. So, I'm going to share my screen.
Hanji, sir, you are audible to us.
Can you see my screen?
No, sir, we are not able to see. Yes, sir, now we are able to see your PPT.
Hello. Hello.
Yes, sir.
Yeah, can you see my screen?
Yes, sir, we are able to see your screen.
It is visible.
Yes, sir.
अब पे रखा क्योंकि मुझे सुनाई नहीं दे रहा है। दो आईडी से ओके। अभी अब मैं एक में वीडियो मैंने कर रखा है, तो अभी आपको दिख रहा है? हेलो, अभी वीडियो दिखाई दे रहा है? हाँ, अभी यू कैन सी माय पीपीटी नाउ। कैन यू सी माय पीपीटी? ओके, ठीक है। यू कैन सी माय पीपीटी ना, एंड यू कैन हियर मी आल्सो।
नो सर, आपकी पीपीटी विजिबल नहीं है।
पीपीटी
नॉट
विजिबल नहीं है?
विजिबल।
somebody is saying it is
नो
visible.
सर।
आपको दिख रही
नाउ
है?
इट इज विजिबल।
इट इज
Sir,
विजिबल।
we are able to see the Sumanta sir's PPT. एक बार सुनील सर आप अपनी साइड का इंटरनेट कनेक्शन चेक कर लीजिए।
ओके, ठीक है, ठीक है। आई विल स्टार्ट। ओके, थैंक यू। Yeah. So what we're doing is we're looking into the AI and robotics in the respiratory physiotherapy, and I'm Dr. Sumanta Ghosh. So I am a teacher and also basically a consultant pulmonary rehabilitation specialist. So I have done my Masters of Cardiorespiratory Physiotherapy and way back in 2012, and then I've been teaching as well as treating patients. Have treated around 10,000 plus patients. I have taught 1,500 plus healthcare professionals, and this has been my journey. So, also our pulmonary rehabilitation teaching program was recognized by WHO in 2023. So, coming into this, so what we're looking is the AI coming in everything, and I think my previous speaker has well informed about AI, what how it is bringing in change in every aspects of healthcare delivery. So, in respiratory care also respiratory physiotherapy also it is creating a lot of changes. So what you're looking is machine learning algorithms are looking at interpreting data, and there are a lot of basically EMRs are coming with AI now, which helps to predict if they suppose if it predicts early that if the PCO2 will rise or the oxygen will drop. So that gives an ample time for us to decide the treatment strategies. It also helps in diagnosis and monitoring. We look into the diagnosis, and it improves diagnosis at least by 30 to 40%. In some cases, it is also claimed that it is better than human interfaces at many of the times. So what we're looking at is the AI looking into the early disease detection. It is also looking into the better interpretation of the PFT and the X-ray reports in the looking into the PFT and X-ray reports of the patients for looking into better. So there's something called CheckNet. There is also something called as Google here. So this is also Google here. I've been also using this for my PhD project. So what is this is it is a machine learning model which produces embedded based health acoustic data. That means you put a microphone and that data is being recorded, and then the AI model is trained on that data. For example, you can train this data for looking into the cough sounds and knowing what kind of disease it is. It is also looked for looking into the cough sound or exhalation sound and looking into your PFT details, and we're also looking into diagnosing basically having action if the patient will have a COPD or will have a tuberculosis or your ILD in the future. So this here AI has already been trained in 300 plus million 2-second audio clips of different patients, and this gives basically very good output in terms of looking into just the sound and trying to look into the lung function. And then there's another AI called as Unit Insight, which looks into the X-rays, and it predicts if it is a pneumonia, and the pneumonia prediction rates of this is around 75 to 80%. So a lot of changes are coming in robotics. So if we look into the robotics, so there is a lot of change. Robotics, just showing of the video. So anyone can confirm if you can see my video. Yes, no. Any one of you?
Yes, sir, we are able to.
Able to see. So this is ICU robots. This is one of the ICU robots. It is called as Hokomo. So what it is doing is basically it is a table with exoskeleton with NEMS, neuromuscular electrical stimulation, and here you can see basically we have the option of putting basically looking into the power, and according to the power the machine decides what is to be the what is the spasticity level or what is the tightness level if it is a neuromuscular patient, and if it also looks into the strength level of the patient, and according to that it suggests basically the treatment timing and number of repetitions that should be done. So I'll play the video again so you can see here. This is the patient that has been connected to it, and it automatically does what is basically programmed to do. So using this kind of robotics is changing how we deliver ICU rehabilitation or bring out the patient from the ICU at the earliest possible. So this is helping in many ways in treating patients in this thing. Then therefore also for the airway clearance techniques, there is some robots that has come up. So there is a closed suction that is connected to a tracheostomy tube, and whenever basically the AI probe feels that there is some secretion that has been developed with the help of sound as well with the help of basically the sensors, liquid sensors. So what it does is automatically does a suction. So it doesn't require manual suctioning at all the time. The AI senses it and does the suctioning. So it is making work easier for us. But ultimately, the driver's position is in the basically the healthcare professional seat. So there is also basically the AI who have been trained now to do the ventilatory setting. Suppose there is a patient, COVID patient, and you cannot do the setting inside the ICU of the ventilator. So you can just operate it with the help of the AI from the outside only. So with the respiratory muscle testing now, so you can see here Android manometer that we used to use in the 1980s, and we have come to AI based that I'm using on the far right and top. So this is basically you just exhale out and it basically measures the respiratory muscle strength, and it depicts that if it is according to your height, weight, and age, if it is correct or not. And it also suggests that if you're doing it correctly or not correctly. So it is a lot of improvement in during the training also. If you see this respiratory muscle trainers are becoming basically from far right, you can see the threshold spring devices that we used to use, and here the flow tapered computerized devices that we're using more and more. And what is happening is basically the AI is improving the outcome. It also suggests and it gives a biofeedback when you're training the patient for respiratory muscle strengthening. So what should be done, and it basically keeps on giving a continuous feedback and goes also. So these things are changing how we treat the patient in many ways, and it already spoke about the ventilatory adjustment that it is doing. So and basically remote monitoring and the telepulmonary rehabilitation also, AI is coming in a big way. So there are now chatbots already available, AI chatbots which speak to the patient on the WhatsApp, and they try to basically give the patient the exercise what has been already fit in according to patient's symptoms. So that is there, and also there is basically a camera vision which tracks the exercises of the patient, and the AI basically based bot also gives a visual communication if the patient is doing exercises in the right way. So these are coming in a big way. There are also ICU smart beds that have come in. So just stop the PPT. Able to see everyone. How can I stop the share? Can you see me now? Hello, guys.
Yes sir, yes sir, we are able to see you.
Okay,
सर ऊपर रेड बटन होगा ना स्टॉप शेयरिंग, वहां से आप स्टॉप कर सकते हैं.
Sorry, I'm not able to hear you.
सर लेफ्ट हैंड साइड पे ना स्टॉप शेयरिंग लिखा होगा, आप वहां से स्टॉप कर सकते हैं.
I'm not getting the stop share button. Can you basically stop it from your end? Leave meeting there. Stop share. So I'm not able to stop the share, I think, somehow.
Okay sir, no issues. Thank you so much sir.
Yeah, no problem. So what we are also looking into is the ICU patient beds, which can also calculate the patient's resting metabolic rate, etc. Also while treating the patient, so that you can also do the nutritional supplementations in that way, so that the patient is adequately nutritionally supplemented. And also some of the beds have come with basically early rotation systems and bed sore, pressure sore prevention systems that are already there. So AI is changing how we see patients in the ICU, in the wards, and also in the OPD. So I think that is bringing a lot of change. So if there is any question, I will be open to that.
Yes, sir. We want to ask that how can AI improve early detection and monitoring of respiratory diseases like COPD or asthma?
Okay, if you can repeat. Didn't get it.
Yes.
fully.
How can AI improve early detection and monitoring of respiratory diseases like asthma?
Mhm. So I spoke about the Google here this thing acoustic model. No? So what is doing is you can just use your smartphone and the apps are coming up. And their developers are also working. We are also working in something similar to that. So where can just patient can just do a cough out in the basically app by using the microphone, and with that only the AI will predict if the patient is having basically what is the FEV1 by FVC ratio, that is the obstruction levels of the patient, and with that we can know if the asthma is progressing or if it is decreasing with the medication or with the therapy. So hopefully that answers your question.
Okay, sir. Thank you so much. Sir, one more question. What are the biggest barriers in healthcare professionals facing in adopting AI?
Hello, yeah, what was the question? Sorry.
Anji, sir, what are the biggest barriers in healthcare professionals facing in adopting AI?
What is the biggest challenges, right? So challenges is one is basically the fear of AI, and I think that we should remove, because we have to be AI adapt, and as soon as we become AI adapt, I think our roles will also improve. And healthcare professionals, I think AI, I think we all touched by AI. All our patients are coming basically using AI now. So one thing is when a patient comes to you using AI, always think that it is not you should not be angry with the patient for using AI and looking into it, but we have to look that yes, he has some knowledge. That knowledge may be correct, cannot may sometimes it may not be correct. So we have to look into it, and after looking into it, we have to see that what can we do about it, right? And then for the healthcare professionals, we also must get in some kind of training. I think future other speaker was speaking, somebody also asked regarding the training, and I think there are some trainings now available. The government of India has also put in the SWAYAM portal and PTL portal some of the AI courses, and I think basic AI will also be covered in the healthcare courses very soon. Hopefully that answers your question.
Sir, one more question. Do
Yeah.
any of the devices are in the market for giving the positional release in people with burn or any other injuries in perspective to AI?
Yeah, so I just show you the Hokomo robot, which helps in the positioning. So what it's doing is basically from supine position, it takes into basically standing position also the robot. And there are turning beds that I told you that are also coming up now. So they were already there, but there were more basically healthcare personnel different. Now the AI is also playing a little bit role, suggesting that what can be done, how much angle should be removed, if the BP is increasing, and if there's a postural hypotension, we should take it down or not. So that basically AI is doing it in a better way. Hopefully that answers the question.
Yes, sir. Thank you so much, sir.
Thank you so much. So if there is no further question, we
No,
can stop this. So thank you so much for the invitation, and I think it's lovely being part of the conference. And if there is any question, I think my email ID can be shared and phone number can be shared, and I'll be most happy to help the in any of the participants. Thank you so much.
okay. Okay, sir. We will share it.
Yeah, thank you so much.
Okay. Thank you so much, sir.
So,
We extending a heartfelt gratitude to the speakers, participants, organizer team, and supporters who made this webinar a success. Together with PGIMER, PDF Care continues to work towards preventive healthcare, holistic wellness, and empowering future healthcare professionals with innovation and knowledge. Thank you so much.
Welcome. Thank you.